1.
Use is quietly confident that the tables can pivot.
어? Switch off your mics online.
1, 2.
That's also was the reason why I called my you.
Madam Speaker,
Recording in progress.
There'll now be a moment of silent prayer and meditation. May we be seated? Order, honorable members, those of us who are coming in, can we take our seats? Honorable Ntlangwini, you are going away when you are supposed to be taking your seat. Honorable Ntlangwini, the session is in order. I thought you were going out. Thank you very much. Okay, Honorable Ntlangwini.
No, Speaker, I'm doing my duties as a whip to check all of my members.
Thank you very much, honorable members, and welcome to those who are online in the sitting. Honorable members, the first item on the order paper is member statements. Can I now ask the ANC if they wish to make a statement? Yes, honorable member.
Honorable Speaker, the ANC welcomes the announcement that South Africa has officially been removed from the Financial Action Task Force grey list. This removal from the Global Anti-Money Laundering and Terror Financing Watchdog, confirmed on Friday, 25 October, provides a boost for increased foreign investment in the country. It also serves as motivation for institutional strength that may lift sentiment, lower bond yields, and ease debt servicing costs. This removal is a direct outcome of decisive and coordinated action taken across the government of national unity, law enforcement, regulatory bodies, and the financial sector. Over the past 2 years, the country has implemented comprehensive reforms to address the deficiencies identified by the Financial Task Team Force. We congratulate all relevant government departments and government agencies on the success of their individual and collective efforts and acknowledges their commitment to ensuring that the country exits the FATF grey list. We commend the leadership of the South African government under President Cyril Ramaphosa for driving this turnaround and for demonstrating that South Africa is serious about restoring confidence in its institutions and financial systems. I so move.
Thank you. The Democratic Alliance.
Thank you, Honourable Speaker. I rise on behalf of the DA to notify the House of the great graft and improper relationship between the ANC and Action SA in Tshwane. The Action SA Executive Mayor, Dr. Nasipi Moya, is protecting the ANC Deputy Mayor and MMC of Finance from not releasing a forensic report implicating the ANC Deputy Mayor from financially benefiting from a security tender and not declaring his interest. The city has declared 170 million on this tender to investigate. Another question that needs answers is, why is the EFF not taking the coalition partner to task? The City of Tshwane residents needs to get the truth, and Executive Mayor must come clean and should have fired her deputy already. It's clear who's ruling Tshwane. It's not Action SA. The DA has called for the dismissal of Modisi as Finance MMC and to pursue his removal as Deputy Mayor. Why no
order, honourable members. You may proceed.
The DA also later complained with the public protector to get the truth. We urge the Minister of COCTA, the COCTA Committee, and all oversight bodies like the AG to act with urgency to interrogate this matter, to check if any decisive action will be taken by the Action SA Mayor.
You can proceed, honourable member. Order, honourable member, can you proceed?
I'm trying, Speaker, very hard. To the residents of Tshwane, the DA will ensure concrete action and accountability is implemented to restore confidence in governance and how taxpayer monies are spent.
Thank you, honourable member. Your time is up. MK.
Thank you, Honourable Speaker. Today I rise on behalf of Umkhonto Wesizwe Party to address a matter of significant public concern. As highlighted in the recent media reports, there are disturbing allegations of bribery involving certain members of our judiciary. Specifically, a judge is alleged to have accepted a 2.5 million rand bribe to conceal the details of the CR17 funders from the public scrutiny. In light of these concerns, we unequivocally support the call by our president, the only commander of Umkhonto Wesizwe Military, President Zuma, for comprehensive lifestyle audit of judges, magistrates, and prosecutors. Such measures are vital to maintaining the integrity of our justice system and ensuring the impartial upholding of the rule of law. Let us reaffirm that no individual is beyond accountability. By endorsing these measures, we pledge our commitment to a transparent and trustworthy judiciary that faithfully serves the people of South Africa. By implementing these rigorous and non-negotiable audits, we will send an unambiguous message that in the Republic of South Africa, no one, and I mean no one, regardless of the title, robe, or political affiliation, is above scrutiny or the law. This is a step towards rebuilding a truly trustworthy and transparent system that serves the people of South Africa faithfully. I thank you, Honourable Speaker.
Thank you. African National Congress.
The ANC condemns in the strongest possible terms the incident of bullying at Milton High School, where a learner was assaulted by a group of fellow students in what it appears to be a coordinated attack. A disturbing video of the incident that was circulated on social media depicts the learner being physically and verbally attacked by a group of boys while others stand by, some even cheering on the perpetrators. The incident reportedly occurred on the 16th October 2025, shortly after classes ended, and involved learners allegedly including members of the school's first team rugby squad. This type of behavior has no place in society and should never be tolerated. There must be zero tolerance for bullying and violence in schools. Schools must be safe spaces for learning and growth, not fear and humiliation. We welcome the decision by the official to precautionally suspend the 8 learners who also appeared at the Cape Town Magistrate Court on Thursday, 23 October. We encourage our learners to be disciplined and stay focused at the task at hand to learn and study for the examination. I thank you.
Thank you. Economic Freedom Fighters.
Thanks Somlomo. Somlomo sitsazivezela ukuthi lento yenzeke lapha eThekwini emafletini wakwaHome ku-Field Street. Lapha kulimale khona ingane zamawele zakwaDlamini. Ayisiphethe neze kahle. UBukhaya Dlamini ulimalelwe ingane zakhe zamawele eziwe eliftini eyodwa inganeke yasidlula emhlabeni lena enye sasesibhedlela. Sizike Somlomo akekho umzali okumele alimalelwe abantwana bakhe ngesihluku esinje. Kakhulukazi kuyinto ebonakalayo ukuthi yenziwe ngamabomu. Angithi phela abaphathi beyindawo zokuhlala kakhulukazi la kuhlala khona abantu abamnyama abanendaba nempilo yomuntu omnyama kodwa khanjiswa phambili indaba yemali yerent with no regard for safety abantu abahlala khona. Ingakho nalawa ama-lift alapha kwaHome abenganakiwe futhi engaseviswa. Sithi-ke Somlomo sikusho lokhu singananazi ukuthi alikho izinyane livube ladliwe zingwenya kwacebe isiziba. Abaphathi bakwaHome abalethe footage ezoveza ukuthi ingane zilimale kanjani kungenjalo bayokubona kwabona uSawuli. Sithi-ke le march ebisiThekwini izolo ibincane kakhulu kunento ezosa. Kungekudala so sizothi wonke ama-building awaHome avalwe sicele nabantu abahlala khona ukuthi baphume baphele up until kube nobulungiswa kwengane zakwaDlamini. Sengiphetha-ke Somlomo sithi dudu kumfowethu uKhaya Dlamini sithi ame njalo aqine sizoba naye kulempi ukuze kube sekugcineni engapheli amandla nomntwana osesibhedlela simfisela ukuphola ngokusheshsha. Ngiyabonga kakhulu.
Siyabonga Inkatha Freedom Party.
Honorable Speaker, the Inkatha Freedom Party is deeply alarmed by the recent revelations that the South Africa has become one of the largest markets for crystal methyl in the world, and that the Mexican drug cartels are now establishing local franchises within our borders. This discovery confirms that South Africa has become one of the largest consumer markets for crystal methyl in the world. Foreign drugs cartels are now franchising their operations within our borders. Honorable Speaker, perhaps we need to ask ourselves, how has a country that prides itself on upholding the rule of law become a conducive environment for cartels to thrive? This is not just a policing issue, it is a national security threat. This exposes glaring weaknesses in our border control, intelligence coordinations, and policing capacity. Addition is devastating families, fueling unemployment, and destroying the social fabric of our nation. The IFP stands firm in calling for coordinated and uncompromising action to protect our people from the growing crisis. I thank you.
Thank you. African National Congress.
Thank you very much, Honourable Speaker. As the ANC, we welcome Cabinet's approval of the Integrated Resource Plan 2025, our country's long-term roadmap for secure, affordable and cleaner energy. This IRP moves South Africa from crisis response to planned execution, underpinned by major investments amounting to 2.3 trillion rand, a just energy transition and a credible path to net zero by 2050. The IRP sets out approximately 105 gigawatts of new capacity by 2039. It provides a balanced mix to keep the lights on permanently while lowering costs over time through large-scale wind and solar, battery storage, distributed generation and flexible capacity, as well as an allocation for gas to power to navigate the looming gas cliff and a 5,200 megawatt of nuclear allocation. All of this is positioned to build South African skills, localization and quality jobs. As the ANC, we support 3 priorities and will exercise robust parliamentary oversight to realize them. Number 1, energy security at its lowest cost. Number two, industrialization and jobs. This IRP must translate into South African factories working, steel, cables, transformers, and components, and a skills pipeline for young people. When nuclear proceeds, it must do so under the highest standards of transparency, safety, and value for money, while rebuilding responsible local capabilities. And number three, Speaker, is about transmission, which is our new baseload. No public or private megawatt will flow without new lines or substations. We call for fast-tracked servitudes,
Thank you very
standardized
much,
designs,
Honourable
and
Member.
funding. I thank you.
Patriotic Alliance.
Thank you, Honourable Speaker. On behalf of the Patriotic Alliance, I rise today to address a matter of grave concern affecting South African learners and their right to access basic education. It has come to our attention that while undocumented children of foreign national parents are being registered in public schools with relative ease, many South African-born children are struggling to secure placements due to alleged administrative barriers, overcrowding, and systematic inefficiencies. We want to place on record that this statement is being made without xenophobic undertones. We are focusing on systematic failures rather than targeting foreign nationals unfairly. This disparity raises serious questions about the fairness and implementation of the Department of Basic Education's admission policies. Why are South African parents being subjected to excessive bureaucratic hurdles when registering their children, while alternative measures seem to be in place for undocumented foreign nationals? Education is a fundamental right protected in Section 29 of our Constitution, and no South African child should be denied this right due to administrative failures or misprioritization. Thank you.
Thank you very much. Democratic Alliance.
Honourable Speaker, I rise on behalf of the Democratic Alliance to call on the Minister for Social Development to reconsider the inhumane inclusion of child relinquished or placed in a baby box into the definition of abandoned child into DSD's Draft Children's Amendment Bill 2025. This proposed amendment will criminalise the act of safe relinquishment, as well as registered child protection organisations that operate baby savers, which have saved at least 600 babies. In contrast, the DA has been working on a private members bill to legalise safe relinquishment, baby savers and baby safe havens. The notice of intention to introduce has been gazetted and open for public comment. The DA's proposed bill will save lives, unlike DSD's bill, which will endanger them. South Africa faces a heartbreaking crisis of unsafe infant abandonment, often as the result of poverty, gender-based violence, or lack of support. We cannot turn away from this reality. We must respond with empathy, humanity, and practical solutions. Minister Tulashi, should this inhumane amendment definition stay in DSD's bill, the preventable death of these babies will be on your conscience. As members of Parliament, we have a duty to stand up against creating laws that punish innocent babies as they take their first breath, as well as desperate mothers in crisis choosing love in the only way they know how at the time. I thank you.
Thank you. African Transformation Movement. African Transformation Movement. I think you have forgotten the full name of the party. Okay.
On behalf of ATM, I rise to call for poverty and unemployment to be declared a national disaster. Over 12 million South Africans are unemployed. That's more than a quarter of our working age population. 55% live below the poverty line. 2 in 3 children grow up in households where basic needs are not met. These are not statistics. They are stories of daily suffering and lost dignity. The Constitution guarantees the right to dignity, education, housing, healthcare, and freedom from hunger. When poverty and unemployment strip away these rights, the state has got a constitutional duty to act with urgency. Declaring this crisis a national disaster is not symbolic. It would enable coordinated national action, reprioritize budgets, fast-track job creation and infrastructure programs, and hold government accountable under a measurable framework. Just as we mobilize extraordinary measures during COVID-19, we must now do the same to confront this pandemic of poverty and joblessness that is destroying more lives each day. The ATM calls for decisive action. Let us treat unemployment and poverty with the urgency they demand. I so move. Thank you.
Thank you. African National Congress. I think there are 2 of you. Decide who starts. Okay.
Okay, thank you very much. The African National Congress of Oliver Regional Tambo, Umachi, Goba Umbus stands today to say the DA-led Stellenbosch municipality was recently punished by the courts for their racial exclusivity practice. Following an October 18, 2025 court ruling, the DA-led Stellenbosch municipality was ordered to pay a qualified colored job applicant 750,000 for overlooking her in favor of a less qualified white candidate. This follows an earlier separate finding of racial discrimination in 2018 for a similar case. The latest ruling against the municipality involves an incident that occurred 6 years ago. This has highlighted a pattern of racial discrimination and employment equity issues in the DA-led municipality. In September 2025, a video surfaced of former Acting Corporate Services Director Alexander Kahnemeyer expressing concerns about the dominance of white males in senior management and allegedly discussed making life difficult for non-white employees to encourage them to resign. Following the leak, the DA initiated a motion to suspend Kahnemeyer and the mayor called for an investigation. We believe that—
Honorable Member, your time is up.
Thank you.
Kondo Party.
Honorable Speaker, I rise on behalf of Umkhonto to state that South Africa faces a terrifying reality. Organized crime is no longer fighting the ANC, it is financing the ANC. We now hear allegations that the suspended Minister Senzo Mchunu has been meeting criminals and tender syndicates not to combat crime, but to fund his ANC presidential ambitions. Cyril Ramaphosa opened this. This is not new. Cyril Ramaphosa opened the floodgates when his Sierra 17 campaign was bankrolled by millions in secret. Pala exposed dirty dollars protecting a president. The ANC corruption shows us how money replaces democracy. Now, drug lords bankroll the ANC events.
Order, Honorable Member.
Crime bosses choose the—
You're out of order and they're calling you to order.
Honorable Member of the MK Party, I think we need to be careful in our statements so that we do not veer on matters that require substantive motion. So can you please make sure that in your statement, you do not create that problem for yourself?
Thank you, Speaker. Now, the drug lords bankroll ANC events, crime bosses choose ANC leaders. The highest bidding gangster can buy the presidency. Speaker, that is not leadership. That is mafia in the Tuli House. How can police fight crime when criminals fund their bosses? How can democracy exist when votes are replaced by bribes? MK demands a transparent investigation into Caucus revelations, a ban on secret political financing, accountability for captured criminals.
Order, Honorable Member, your time is up. Economic freedom fighters.
Honorable Speaker, I rise in order to raise a serious issue about the aviation industry. There are growing reports of small aircraft involved in accidents. In just the past 3 months, 2 crashes were reported in Durban. These are not isolated incidents. Several similar accidents have been reported elsewhere. This pattern points to a deeper crisis in South Africa's aviation industry. Anyone who regularly passes through our airports can sense that things are deteriorating. Flights are delayed more frequently. Technical faults are becoming common, and there's a general sense of disorder. Must we wait for lives to be lost before decisive action is taken? The warning signs are all around us. The aviation sector is showing cracks that can no longer be ignored. We cannot look away while these dangerous incidents pile up, threatening public confidence and human lives. The South African Civil Aviation Authority has a duty to ensure strict oversight and compliance with safety standards. Is the authority paying sufficient attention? Or are we now witnessing yet another institution that has lost its capacity to enforce accountability. Thank you.
Thank you. African National Congress.
Thank you, Madam Speaker. As the ANC, we dismiss the Democratic Alliance bid to scrap black economic empowerment policies which are rooted in the country's constitution. Whilst the DA aims to eliminate race as a factor in public procurement, we believe BEE is vital in addressing historical inequalities. Introduced in 2003, BEE is a tool for redress to correct apartheid-era economic imbalances. The policy requires companies to meet targets in ownership, management, skill development, enterprise support, and socio-economic contribution to qualify for state contracts. And we believe that these policies are essential for reconciliation and inclusive growth. Madam Speaker, BEE policies have created black industrialists and changed management control and patterns of ownership in companies. We have seen real changes in ownership patterns, including more business owned by women. We have seen changes in management control, enterprise development, and skill development. But we have a long way to go in redressing the vast disparities of the past and balancing redress with inclusive growth in a country still grappling with high unemployment and poverty rates. Thank you, Chair.
Thank you. Democratic Alliance.
Honourable Speaker, the South African government is our nation's largest employer with over 1.2 million employees. This workforce should be the backbone of stability and growth, but instead our public service payment system has been hijacked by ghost workers who simply don't exist. Almost 4 billion rand is lost to these ghost workers every year. This 4 billion rand is money that is nearly impossible to recover even when the fraud is detected. What is deeply troubling is that these ghost employees don't just appear by accident. It takes at least 3 government officials working together to create one ghost worker, pointing to organized criminal syndicates operating within departments. These fraudulent payrolls continue running for employees who have died, retired, or resigned. There are even minors receiving salaries and individuals drawing allowances from multiple departments simultaneously. The DA has long advocated for biometric verification systems and regular data matching with Home Affairs to prevent this exact fraud. These technologies exist and are used successfully in the private sector. Every rand stolen through ghost workers is a rand that could be spent on healthcare, education, and other vital services our people need desperately. We need to not only find the ghost workers, we need to investigate and prosecute the criminals behind them. I thank you.
Thank you. African National Congress. The ANC.
Thank you very much, Honorable Speaker. The ANC celebrates 1 year of good governance by the ANC-led coalition government at Greater Tshwane region. For the first time in years, Tshwane has tabled a fully funded budget. The ANC-led coalition reached and maintained a payment agreement with Eskom, reducing the debt from 9 billion to 5.6 billion. The inaugural Tshwane Investment Summit secured 86 billion worth of investment pledges. These pledges will help create jobs, unlock catalytic projects, and grow city economy. The DA must listen now. The SA Cities Network recently named Tshwane as the South Africa's most improved metro. The DBSA support upgrade of Rooiwal is ahead of schedule. Over the past year, the city reduced its Eskom debt by 3.4 billion, with the current Eskom account fully paid and up to date. When the ANC took office, the ANC-led coalition took office, the city faced 13 areas of non-compliance under the DA leadership. In this financial record keeping, consequence management, and targeted audits, these are issues that the ANC-led coalition has resolved. I so move. Thank you very much, Speaker.
Thank you. Can we now have Al-Jama making a statement?
Thank you, Madam Speaker. In the name of Almighty, the most gracious, the most merciful, for Muslims, Hajj is the 5th pillar of Islam, and every Muslim who is physically and financially by the means must undertake this holy journey to Mecca in Saudi Arabia at least once in a lifetime. Hajj is extremely sacred in terms of fulfilling Muslims' rights. The pilgrimage is a deeply spiritual journey, and some Muslims save money for many years to be able to go on Hajj. Every country receives a Hajj visa of 0.1% for Muslims in this country to get a Hajj visa to perform this pilgrimage. However, the South African stats have recorded incorrectly 1.2 million Muslims in the country, and based on this number, only 1,140 visas by the Hajj Ministry is issued to South African Muslims. This limited quota for visas is causing a huge discomfort and a lot of heartbreak, as many who have taken years to save for this holy journey and now ready to undertake it are denied the opportunity because of the limited quota on Hajj visas to South African Muslims. There are older persons who have died of a broken heart because they did not make it for the limited quota. Al-Jamaa believes the total of South African Muslim citizens could be as high as 3.5 million approximately, and this would then entitle 3,500 visas per year.
Thank you, Honorable Member. Your time is up. This concludes the member statements.
Speaker.
Are there any ministerial responses?
Speaker.
Yes, Honorable Member.
The NCC has not been given an opportunity to deliver a statement.
Honorable Adams, today you are not on the list. As you know, that smaller parties in their caucus will decide on rotation basis who will come on what day. So today, I'm so sorry you are not on the list.
Thank you, Madam Speaker.
Thank you. Order, honorable members. Order. Honorable Sangwini. Order. We now have concluded our member statements. We are taking ministerial statement. I will start with Minister Dion George.
Thank you. On the statement on broad-based Black economic empowerment, we all agree that we need economic growth and that we need to have an inclusive economy. We also all agree that past injustices in South Africa have left a legacy which, with many South Africans left in poverty. The existing framework for broad-based Black economic empowerment is not working and has resulted in a few becoming extremely rich under the guise of empowerment when the vast majority of our people have been left behind. We must review the current legislation on BEE with the view to ensure that we can tackle inequality on the basis of actual need. And that need is to focus on people who are currently battling with poverty. It is possible for us, with the right policy, to actually get a broad-based improvement in our country for everyone. Thank you.
Thank you. Honorable Minister Chrissy.
Thank you very much, Honorable Speaker, and allow me to thank Honorable Niehaus for raising concerns with regard to air traffic safety, particularly in the light of the large number of civil aviation accidents that have occurred in the recent past. Honorable Niehaus, I want to assure you that South Africa Civil Aviation Authority regularly audited.
Honorable Minister, if you can find a better position.
Honorable Speaker, is this better?
Yeah. That's better.
Is that better? I'm sorry, there's a lot of background noise. Honorable Speaker, I'm saying that I want to thank Honorable Niehaus for raising concerns with regard to recent air traffic accidents and to assure him that the South African Civil Aviation Authority is regularly audited by ICAO, the international body, both in terms of compliance and capacity. I want to also further assure him that all of these air traffic accidents will be investigated by the relevant authorities, and where there are significant learnings, we would obviously want to ensure that we implement these in future policy initiatives. Let me also request the civil aviation sector to take account of the fact that we are currently experiencing the onset of summer rain and bad weather, and to request that those piloting light aircraft consider climatic conditions before they take off, but also ensure that all of their craft have undergone necessary safety and maintenance checks. Thank you very much, Honourable Speaker.
Thank you. Honourable Deputy Minister Nell.
Thank you very much, Speaker. I wish to thank and welcome the statement that South Africa has exited from the Financial Action Task Force grey list, more formally called the list of jurisdictions under increased monitoring. I think this is really a demonstration of how a capable ethical developmental state can and should work, bringing together the whole of government and working in a dynamic way also with the private sector and society as a whole. However, while exiting the grey list is an important milestone and a demonstration of South Africa's commitment to rebuilding the rule of law, it is only the start of a broader process to continue strengthening key institutions, improve enforcement and governance processes, and ensure that such improvements are sustainable and that our systems become increasingly effective in combating money laundering, terrorism financing, and the proliferation of illicit financial flows. Neither government agencies nor regulated entities in the private sector, and Parliament for that matter, can afford to become complacent and stop improving. Instead, through public-private collaboration, we must continue to strengthen South Africa's anti-money laundering and combating the financing of terrorism systems. I thank you.
Thank you, Honourable Member. I've not received any other requests for ministerial responses. This now brings to an end the section on member statements. But I also want to just caution members, in our statements and the quest to raise issues either from party or our constituencies, we should be careful, particularly where processes are still in place, not to actually make certain comments that might actually affect those processes. There were issues that were raised earlier where I made a similar commission. As we know, the Madlanga Commission, the ad hoc committee is still in process. So we need to really find a way in which we do not impact negatively, maybe with our statements on the processes that are still going to come before this House for us to make decisions. I just thought it is important for me to raise that matter. Honorable members, today we are going to have an important debate that deals with a matter of healthcare, but also of human health generally, where we will be reflecting on the issues of tuberculosis. And as you know, that as our country, we have been in the forefront of leading the fight against this, and at a parliamentary level, since we became part of this move, we had a TB caucus in Parliament led by the Portfolio Committee on Health and Select Committee on Health, but also it allows other members who have an interest on the matter to be part of that caucus. This is not only a caucus here in South Africa, but it's really involved a movement of a number of MPs globally, in our continent, in our region, SADC, but but also in the entire globe. I just want to welcome, before we start, the members who are here with us from non-government organization, but also from SANAC, as well as our chairpersons of Portfolio Committee on Health from Lesotho, Honorable Makalanyane, who is in the House, and Honorable Musanje from Zambia, who's also the chair of the Health Committee. Honorable Makalanyane, please stand up so that other members can see you. I think Honorable Makalanyane, you can take your seat, sir. He did not stand up in the beginning because he was here in the first term, just visiting our parliament and meeting with our then chairperson, Honorable Jomo, at the time, who was our chairperson. Order, honorable members. Parties make decisions about their members, how they redeploy them. You can ask the chief whip or the deputy chief whip of the African National Congress. Honorable members, I also want to announce that at the end of the debate on TB collaboration, which we will be debating, we will sign as Parliament the Barcelona Declaration, which aims to revitalize the South African TB Parliamentary Caucus to press for a more effective response to the tuberculosis epidemic. The signing ceremony is scheduled to take place at the Imbizo Center in 120 Plain Street at 4 p.m. Not all of you will be able to go because the House is in session. So few of you will go and witness that signing and will come back to the House because the business of the House, yes, still continues. So you are not exempted, members of the Portfolio Committee of Health. I'll now ask Honorable Minister of Health, Honorable Mtswaledi, to lead the debate.
Honorable Speaker, honorable members of the House, our guests from the SADC region, chairperson and members of the Portfolio Committee on Health, members of South African National AIDS Council, good afternoon. Tuberculosis remains one of the most pressing public health challenges in South Africa. Our country is among just 10 countries worldwide with a high burden of TB, a high incidence of TB among people living with HIV, and a high rate of drug-resistant TB. In the years leading to 2009, TB incidences and mortality began to rise sharply, driven largely by the HIV epidemic. The expansion of antiretroviral therapy has since helped to reverse this trend, saving countless of South African lives. The question, honorable member, is why TB is still such a scourge. A century and a half after Robert Koch identified the bacteria that causes it. It was on the 24th of March in 1882 that Robert Koch announced to the world the organism that causes what was then already a centuries-old disease. Signs of TB were identified in Egyptian mummies, which were buried centuries ago. But honorable members, TB has been treatable for the longest of time. So why is this identifiable and treatable disease still causing immeasurable damage to individuals, families, communities, and indeed nations? Many other pandemics for which no treatment was ever found came and went. But TB, which is treatable, still remains with us. Many in this house may not believe it when we mention that TB killed more people than all the known pandemics, past and present, all added together. Yes, it is a fact that TB killed more people than bubonic plague that devastated Europe in the 18th century. And even before that, you can add to that toll smallpox, malaria, Ebola, yellow fever, hemorrhagic fevers, cholera, mpox, HIV/AIDS itself, COVID-19, and influenza. Yes, TB killed more people than all of those I've mentioned, not individually, but added together. Why then do nations not show any agency in dealing with this biggest world killer of all infectious diseases? Why is there no sign of fear of TB like we fear other pandemics? The simple answer I can find is that TB is not a drama queen. It makes no noise. It does not announce its intentions. It causes no global leaders to close down borders. It causes no heads of state to address family meetings. It grounds no aeroplanes. It closes no businesses, schools or churches, but it kills, and it kills very effectively. Unfortunately, very slowly, and most of the time, very silently. Now, this morning we launched a parliamentary TB caucus for members of parliament to join the war against TB. It is the second time that we launched this TB caucus in this parliament, but it just faded away because, as I said, we don't really fear TB, despite all the evidence being there that is a problem. But having said this, honorable members, you must take heart of the fact that since 2015, we've achieved measurable progress. New cases of TB have declined by 57%, meaning that the estimated number of people contracting TB annually has decreased approximately from approximately 600,000 in 2015 to 270,000 in 2023. Of the 270,000 individuals living with TB in 2023, 13,000 had multi-drug resistant TB, and people living with HIV and AIDS accounted for 54% of the total TB population. While the reduction is in new cases encouraging, in 2024, the report serves, by 2024, the report serves as a reminder that TB still affects hundreds of thousands of South Africans each year. Between 2015 and 2023, over 500,000 South Africans died of TB. And in 2023 alone, 1 in 5 people succumbed. That's a case fatality rate of 22%, amounting to 56,000 deaths of the 270,000 infections. TB-related deaths among people living with HIV have declined by 31%, but regrettably, TB still among those TB deaths among those without HIV increased by 25% over the same period. The human cost extends beyond lives, as more than half of households affected by TB face catastrophic costs, demonstrating that TB continues to exacerbate poverty as well as illness. TB treatment coverage is improving, with 79% of the 270,000 people which we have mentioned with TB in the country identified and treated as of 2023. We continue to intensify our efforts to detect new cases and close this gap. To end TB, we must identify all individuals living with the disease, treat them, and most importantly, cure them. This will help break the chain of transmission in our communities. Treatment success for standard drug-resistant TB now stands at 83%, while success rate for the 6-month regime for multi-drug resistant TB ranges between 75 and 80%. Loss to follow-up remains a challenge, with 8% of patients with drug-sensitive TB and 9% of those with drug-resistant TB discontinue treatment. Children and young adolescents are of a particular concern. They are significantly underrepresented in the TB notifications, accounting only for 10% of all cases. We are implementing the SANAC and World Health Organization TB multi-sectoral accountability framework, ensuring that all partners, including the Department of Education, deliver clear outcomes.
Honorable Mpele, please mute. Minister, you can continue.
Clear outcomes to improve TB situation for children. Failing children in this regard will be a grave indictment on all of us. Honorable members, despite the challenges that we have outlined, we are also making noteworthy strides. The National TB Program, through the TB Strategic Plan, Annual TB Recovery Plan, and Targeted Universal Testing for TB approach, continues to maintain focus on TB to ensure we do not falter. We have established a multi-sectoral TB technical task team coordinated by SANAC, which leads the work of TB technical working groups comprising all of government departments, civil society, the private sector, and development partners, such as the World Health Organization. To accelerate progress, in February 2025, the National Department of Health launched the NTB campaign, which aims to screen and test 5 million people for TB annually. The campaign integrates TB screening into routine monitoring and evaluation meetings across provinces, ensure coordination with national HIV response. To track progress, honorable members, last week on Friday, we launched what we call a public-facing NTB campaign dashboard. This dashboard enables provinces, partners, civil society, and the public to monitor testing, treatment, and outcomes in near real time. It serves as a tool for transparency, accountability, and action. Civil society can utilize the data to promote testing, reduce stigma, and hold local services accountable for delivering TB care. We are not just going to announce to you that we are looking for 5 million people every year to test. You will be able to trace it. If you want to know in which village have we been, who has been found to be having TB, what age are they, what is the agenda, all that information you will get from this data that we have launched last week. We have also strengthened our diagnostic and treatment services. New rapid molecular tests enable us to detect TB within hours than days. You remember we were the first to initiate the gene expect technology, whereby TB diagnosis was now within 2 hours than the 6 weeks which it was taken previously. We continue to collaborate with National Institute for Chemical Disease and National Health Laboratory Services to deliver testing methods, particularly in multi-drug resistant TB. This is essential for fast detection and treatment. Newer, shorter, and more effective treatment regime, especially for multi-drug resistant TB, are now saving South African lives and alleviating the burden of the pandemic. Looking ahead, South Africa is preparing for the introduction of a new TB vaccine. Honorable members, as I said, TB has been known from 1882. Since that period, we have had a vaccine called the BGC vaccine, Bacilli calmette-quercetin, for children. We discovered after many decades That vaccine doesn't cover adults. Covers you in infancy, in childhood, but once you become an adult, you're no longer covered. Since that time, the world has been looking for a vaccine. I'm happy to announce to you that there's a vaccine that is very promising called M72. It is being tested in 7 countries rather, around the world. But the biggest testing center is here in South Africa. The people who sacrificed to be tested for this vaccine are South Africans, and we are looking forward for this vaccine when it comes. And we believe by 2028, the trials will be over and we'll start rolling it out. That is our hope. Only then can we safely say we are bringing an end to TB. In the same way as we are hoping about the new injectable for HIV called lenacapavir. I am sure you are aware and you have heard that yesterday, SAPRA, South African Health Products Regulatory Authority, have finished registering lenacapavir, which is an injection that is going to be injected to individuals who are HIV negative every 6 months. And it's guaranteed 100% that you won't contract HIV. We have sat down and put up plans that early next year, we will start rolling out lenacapavir in the country. And if the TB vaccines also become available and we roll both of them out, we have got hope that this scourge called TB, together with HIV/AIDS, will no longer be public health threat as they are. We are taking this battle of TB to G20 next month because 5 member states of G20 collectively account for half of the global TB cases. This is Brazil, Russia, India, China, and South Africa. That is why with G20, them being members, we're going to discuss this issue. Honorable members, you have got a role to play because as we said, TB is not just a medical condition. It is a social and economic conditions. It needs all of us to participate to bring it to an end. Thank you very much.
Thank you very much, Honorable Minister. I'll now ask Honorable M. Dubatse to take the podium.
Honorable Speaker, honorable members, I rise today on behalf of the Mkhondoweziwe Party to respond to the Minister's statement on the fight against tuberculosis and the relaunch of the Parliamentary TB Caucus. We welcome this initiative, but we must be honest, this relaunch is long overdue. For more than 2 decades, South Africa has declared war on TB, yet we remain one of the hardest hit countries in the world. According to World Health Organization, in 2023, South Africa recorded 468 TB cases per 100,000 people, and over 54,000 people, South Africans, lost their lives to this preventable and curable disease. TB is still the leading cause of death in our country, killing more of our people than HIV, diabetes, and cancer. The MK Party demands transparency and accountability. We cannot afford another public health campaign that begins with ribbon-cutting ceremonies and ends in silence. Honorable members, the problem in South Africa is not lack of plans, strategies, or summits. The problem is lack of implementation. The GNU government has mastered the art of duplicating programs without coordination, of building bureaucratic empires instead of functioning hospitals. This is not governance, but it is bureaucratic theft from the poor. Our clinics are overcrowded, our health workers are underpaid, our laboratories are collapsing under the weight of backlogs. The minister speaks of fighting TB, yet we still do not have dedicated TB centers in all our hospitals. How do we win a war without weapons? The MK Party calls for the immediate establishment of specialized TB centers in every hospital and community health facility. These centers must not only provide treatment, they must drive education, prevention, and early diagnosis, especially in rural areas and mining communities where TB spreads fastest. Honorable Speaker, TB is not just a medical condition. It is a disease of inequality, of poverty, overcrowding, and neglect. It is a social justice issue. Our people deserve access to quality care, not fragmented services and false promises. During the recent visit to London, the MK party called upon the Westminster Parliament to hold London-based mining companies accountable. The evidence is clear. Mining activities across Southern Africa contribute over 760,000 TB cases every year, especially amongst mine workers and surrounding communities. These companies have profited from the lands and lives of our workers and our people. It is time for them to pay their debt. We therefore demand the creation of special reparations fund to which these mining companies must contribute 2% of their annual profits as a TB justice levy, as a form of reparative justice for communities they have poisoned and abandoned. President Cyril Ramaphosa must also take responsibility. As a shareholder in several mining interests, he cannot continue to speak about public health while profiting from an industry that has caused one of the largest epidemics on our continent. We further highlight that the private medical aids still do not provide adequate coverage for TB, even though it is listed as a prescribed minimum benefit under South African law. Yet the minister has failed to enforce compliance or amend the necessary regulations. Meanwhile, the Democratic Alliance, on the other hand, continue to fight in court to block broader public access to health care to our people. We say enough is enough. Let this new parliamentary TB caucus not become another talking shop, another symbolic gesture. Let it become a platform for radical action where members of parliament fight for their lives, not headlines, for people, not political convenience. The MK party commits to monitoring this caucus closely. We will hold the minister accountable for every promise made, every target missed, and every life lost. We will fight for the establishment of TB centers, for justice from mining corporations, and for laws that protect our people instead of enriching the powerful. Let us not only talk about ending TB, let us act. Let us act for mine worker coughing in the shaft. Let us act for the mother waiting in the clinic queue, for the child who never saw a doctor on time. The fight against TB must be a fight for health sovereignty, social justice, and restoration for dignity to every South African and for our people. Amanda.
Thank you, Honorable Member. I thought we were going to say the MK party is going to join the TB caucus. Now say the MK party will monitor. How? This is a parliamentary caucus. Thank you very much, Honorable Leroux.
Honorable Speaker, today's topic of debate, tuberculosis, is an extremely important one. It is important because tuberculosis has consistently, year on year, been the biggest killer of South Africans. And though cardiovascular diseases such as heart attacks and strokes are now at the top of the list, TB still kills 56,000 South Africans every year, a number that has remained largely unchanged since 2015. It is important because TB disproportionately affects the poor and the vulnerable. It spreads most easily to people who are malnourished and immunocompromised and find themselves in overcrowded living conditions. It is important because we actually have the tools to beat TB. In most cases, it is completely curable with a 6-month course of antibiotics. So, what is going on? Why are we struggling to get on top of the TB epidemic despite making significant progress with this nasty sibling, HIV? Why do so many people still die from TB? And what can we do to improve things? As a rural doctor, TB was my bread and butter, and I've literally treated hundreds of patients with TB, many of them HIV positive. When patients presented at a hospital emaciated on the brink of death, I was always relieved when a patient was diagnosed with TB and HIV rather than cancer, because with ARVs and TB treatment, I knew that we could get the patient better. With cancer, the prognosis was much worse. But TB isn't always easy to diagnose definitively, and a combination of x-rays, sputum tests, and an experienced clinician is often required. Furthermore, the TB bacillus is hardy, requiring patients to consistently take treatment for at least 6 months. Without good follow-up systems and a well-functioning healthcare facilities, patients often fall out of treatment, may not be cured, and even develop drug-resistant TB. At the peak of the HIV pandemic in about 2009, 2010, more than 200,000 people were dying from TB or a combination of TB and HIV every year. The massive scale-up of antiretroviral treatment has meant that the HIV-positive population in South Africa has developed much better immunity. And as a result, TB incidence has gone down significantly since that peak. During the 16 years that I worked in the rural Eastern Cape, there were some notable improvements in the TB program itself. The rollout of the much more sensitive gene expert testing made diagnosing patients easier and allowed for early detection of drug-resistant TB. New drugs have been developed and were added to the shortened 6 months treatment regimen for people with multi-drug resistant TB, which has been life-changing for many. Despite these improvements, until recently, the focus of the Department of Health appears to have been more on the ARV program than fighting the TB epidemic, and the data reflect this. Treatment completion rates for patients with drug-sensitive TB have remained poor at about 78%, well below the WHO recommended target of 90%, and it is even worse at 58% for people with multi-drug resistant TB. Mortality rates have remained stubbornly high, and though new TB cases have fallen, South Africa will not reach its sustainable development goals for TB by 2030. For South Africa to win the battle against TB, we will need to treat it as the emergency it is. Find funding, do the basics well, and also start doing things differently. The Democratic Alliance believe that the comprehensive approach espoused by the Stop TB Partnership and the Zero TB initiatives will be critical to beating TB in South Africa. The comprehensive approach involves 3 arms: searching for TB, treating TB, and preventing TB. In the South African context, we do a reasonable job of treating patients who are diagnosed with TB, though we still have to improve our treatment success rate to 90%, as mentioned earlier. In terms of searching for TB, however, our current TB program is extremely passive. Healthcare workers simply wait at hospitals and clinics for patients to present with TB symptoms, which delays diagnosis and puts communities at risk. Furthermore, the painstaking work of tracing household contacts and testing them for TB is an aspect of TB management which has been woefully neglected in South Africa. We therefore urge the Department of Health to do more to actively search for TB by, firstly, making widespread X-ray screening using mobile X-ray trucks available to all South Africans, especially those in high TB burden communities. The Department of Health's plan to perform 5 million TB tests this year is a laudable one, but it has to be accompanied with easily accessible and widespread X-ray testing. Secondly, the Department of Health needs to train and use community health workers and clinic nurses to do active contact tracing of every single person diagnosed with TB. Every household contact should either have a mobile X-ray or a sputum scent or both, so we can identify contacts with TB disease early before they have infected others. This will also assist with the third pillar of the comprehensive approach, namely prevention. Household contacts without active TB disease should be given TB preventative treatment to eliminate latent TB infection, which could reactivate at a later stage. The widespread use of TB preventive treatment was shown to be extremely successful in Alaska in the 1960s and is worth emulating in South Africa. It has been positive to see the renewed energy from the Department of Health to fight against TB through the launch of the End TB campaign on World TB Day on 24 March this year and the Minister's announcements today. The political will and focus shown is welcome, but our TB response has to involve more than slogans and promises. The DA believes that adopting a comprehensive strategy that invests not only in treatment, but in active case finding and in prevention is the only approach that will drastically improve TB outcomes countrywide. TB is a national emergency. We should all start behaving as such. I thank you.
The Honorable Chirwa Mpungose. Honorable Chirwa. You have 5 minutes.
The Minister stands here today to relaunch a very progressive campaign targeting multi-stakeholder efforts to combat tuberculosis, which is our country's leading cause of death to date and often linked with HIV. It is intended to identify TB cases early through widespread testing of TB, to offer immediate treatment for those testing positive and building on HIV treatment successes to curb TB transmission and drug resistance. We hope National Treasury will provide the necessary resources to see through a success in this program of action. However, our concerns arise from the following, Minister. A progressive intervention in the early 2000s aimed at combating mother-to-child transmission of HIV has sadly been reversed over the years due to government failure to maintain its successes when it comes to fighting new HIV infections today. It is a concern for us that the children who were saved from HIV infection in 2007 are the very cohort today that dominate HIV infections in South Africa. The government of today must recognize this unfortunate regression. What was the point of preventing mother-to-child infections only for HIV to find them in their teen years and in their 20s? Why has government failed to defend these gains despite interventions available to do so? We truly hope that you won't compromise on access for LEN like you did for PEP and PrEP, particularly for Black girls in townships and rural areas. Furthermore, there is a persistent case detection failure of 40–50% of TB cases that remain undiagnosed. And this is not due to patient avoidance, no. It is the case due to health system missed opportunities during clinic visits. Outdated smear microscopy that is still used in many facilities detects only 50–70% of cases compared to other tools of detection systems, some noted by WHO and the Minister today. Minister, it is unrealistic to target 5 million tests annually when you rely on inconsistent diagnostics, more so in rural areas and township clinics. This leads to missed cases. It fuels transmission, especially of drug-resistant TB. These diagnostic system breakdowns affect us in high-burden provinces like in KwaZulu-Natal. Poverty continues to be a barrier for many. This program of action lacks a multi-sectoral action plan that is inclusive of nutritional programs. Our people do not take medication because they are hungry. Literally, poverty continues to be a barrier for many. This program of action in endemic areas like Cape Town continue to fail in reducing infections as per 2025 reports. We propose the following as the EFF to ensure that this program results in a success and not another good on paper but intangible POA of the GNU. Enhance case detection through advanced diagnostics, replace all other outdated smear microscopy and integrate TB screening in all clinics by 2027. Invest 500 million from the 2026 and 2027 health budget to procure relevant diagnostic systems for rural and township clinics. There is scientific evidence that modern diagnostic tools doubles detection rates for TB. Train 5,000 healthcare workers by mid-2026 on integrated HIV and TB protocols. Diversify funding by increasing domestic TB budgets and engage private sector partners. Establish a 2 billion national emergency fund to offset the 8 billion PEPFAR loss and streamline drug procurement via a centralized digital system linked to the TB dashboard. Propose a 5% increase in budget for health for 2026 that will target drugs and community programs. Partner with mining companies that remain a high TB risk for 200 million annual contributions. Deploy NHLS to monitor supply chains and ensure drug availability of 95% by 2027. Provide adherence support via community healthcare workers, or even offer incentives like transport vouchers to reduce dropout rates. Train 10,000 community healthcare workers by 2026 to deliver TPT and to monitor adherence. Launch a 100 million national anti-stigma campaign that will target men who currently make up only 30% of testers. Male testing should be increased to no less than 50% for this program to have the desired impact. Include medical geographers in this campaign.
who have the necessary academic tools to answer the questions of geographic domination of certain illnesses. Give our people the necessary nutrition. Not only does nutritional support assist with adherence and completion of medical treatment, but it also aids in lowering stigma. We also call on this parliament to ensure that this project is a cross-sectoral and cross-ministerial program. Social development, basic and higher education, and provincial departments must all have their hands on deck. All provinces must consistently report on a monthly basis to a central task force that must be established by 2026 and led by the Minister of Health. Lastly, concede to the proposal by the EFF and open our clinics for 7 days a week and 24 hours a day. TB doesn't operate within working hours. Once you divorce yourselves from undermining our proposals, our country will progress and our health justice will be a reality that's guaranteed in this lifetime. I thank you.
The Honourable Mhlongo.
Honourable Speaker, tuberculosis remains one of the leading causes of death in South Africa. This remains a great concern for the IFP, given that millions lose their lives and many more suffer daily from the preventable and curable disease. The IFP notes the current unfavorable economic climate, which may limit the financial capacity to combat this disease. However, given the magnitude and the highly contagious nature of the disease, it is in the interest of everyone to contribute to the fight against TB. Honourable Speaker, without targeted interventions, we are fighting a losing battle. Townships, public transport and spaces, workplaces, schools are highly risk spaces for the spread of this disease. These areas must be prioritized for comprehensive awareness campaigns and health drives that include mobile clinics for testing and early diagnosis. Furthermore, to strengthen the fight against TB, collaboration between the government, traditional leaders, the private sector, and civil society is crucial. Employers, transport operators, and educational institutions should partner with the Department of Health to integrate regular TB screening and educate the initiatives in their daily operations. For example, workplace wellness programs, school health campaigns, and taxi rank partnership could ensure consistent outreach, early detection, and community ownership of TB prevention efforts. The IFP believes that medication alone will not win this war. We must re-evaluate our strategies that we have used previously or have employed in the battle against tuberculosis. Moreover, a disease as fatal as TB, despite being curable, cannot be addressed only during the commemoration of World TB Day. What is needed is a relentless daily campaign across the multiple platforms to remind people of the symptoms, to watch for importance of early detection and the risk posed to both the individual and the community when treatment is delayed. The IFP further notes with the concern the high treatment dropout rate among TB patients. If we are to tell a true good story about collaboration in the fight against TB, one of the key measures of success must be ensuring that every patient completes their full course of treatment to achieve full recovery. Therefore, we support the relaunch of the Parliament's TB Caucus unconditionally. In conclusion, the fight against TB demands more than medical solutions. It requires unity of purpose, innovation, and community-driven action. I thank you.
The Honourable Peters.
House Chair, honourable members, tuberculosis is not a disease of the past. It is killing more people today than ever before, and yet it is curable. What it demands is not only new science, but renewed solidarity. The relaunch of Parliament's TB Caucus is more than symbolic. It is a call to action, a call for every one of us to use our voice, our influence, and our power to ensure no one dies from a disease we already know how to defeat. This fight cannot be won in isolation. It will take collaboration across parties, across ministries, and across nations. Together, we can turn political commitment into concrete change and action, but it demands sustained funding to strengthen healthcare infrastructure, research, and innovation. But at the same time, also, we need to alleviate poverty, which is the main driver of tuberculosis infections. Let us make this the Parliament that ends TB through unity, urgency, and unwavering focus and will. The time for action is now. Thank you, Chair.
The Honourable van Staden.
Thank you, Deputy Speaker. Deputy Speaker, in July 2025, during the TB vaccine preparedness workshop held in Johannesburg, the Minister emphasized the urgent need for innovative solutions to combat tuberculosis. The Minister further announced that the next phase will introduce preventative TB vaccination measures, which will also strengthen the ongoing fight against HIV and AIDS. And yet, here we are today. Many South Africans remain skeptical about vaccines that are presented as cures for certain diseases. A sentiment that is understandable given how events unfolded during the COVID-19 period. Many also believe that vaccinations should not be made mandatory and that individuals should retain the right to choose whether or not to receive them. This perspective deserves careful consideration, as we are, after all, a democratic state where people are entitled to their constitutional rights. We take note that the SATB Caucus is not an official parliamentary body, but rather a network of politicians from across all political parties. Its purpose is to raise awareness amongst constituencies, engage with the media, monitor health funding and program performance, advocate for legislation that supports healthcare, and hold government accountable for fulfilling its TB-related commitments. The FF Plus raised an important issue during the Portfolio Committee of Health's 5-year strategic planning workshop held in September earlier this year. The party emphasized that the ministry should provide the committee with regular updates on international meetings and treaties. It is essential that members receive adequate information on these engagements, as well as on developments related to international health regulations. We also need to be kept informed about the international health agenda and the discussions taking place. This is essential for us to update our constituencies and the public on international programs and deliberations, ensuring that misunderstandings are avoided and that public input on these matters is heard and considered. It is equally important that South Africa's sovereignty is safeguarded in the signing of any such treaties. Ons is een van 30 lande in die wêreld met 'n baie hoë TB-koers. Slegs 2.7 miljoen mense was gedurende 23 vir TB getoets in hierdie land. Die Wêreldgesondheidsorganisasie se hoofdoel is om TB-toetse te vermeerder na ongeveer 5 miljoen mense, en deur dit te bereik kan dit 'n afname van tot 29% in die verskyning van TB en 'n vermindering van 41% in sterftes teen 2035 tot gevolg hê. Ons moet egter daarteen waak om alleen staat te maak om internasionale befondsing, ongeag watter instansie of regering hierdie projekte befonds, en ek neem kennis dat die Bill and Melinda Gates Foundation ook hierby betrokke is. Ons kan nie weer onkant gevang word, soos met die onttrekking van PEPFAR-fondse vroeër vanjaar nie. Baie dankie, Adjunct Speaker.
The Honourable Beasley.
Deputy Speaker, South Africa still faces one of the highest tuberculosis burdens globally, with around 270,000 new cases and over 50,000 deaths each year from a disease that is both preventable and curable. TB remains our leading infectious killer, driven by poverty, poor living conditions, and HIV. Action SA welcomes the launch of Parliament's TB Caucus and the Minister's focus on collaboration, data, and accountability. However, treatment alone will not free us from this crisis. Prevention must be at the heart of our TB response. We cannot treat our way out. We must stop the disease before it starts. That means addressing the environment that allows TB to thrive. As long as millions live in overcrowded informal settlements with poor ventilation and sanitation, we will not overcome this epidemic. These are not mere realities, they are policy failures. We commend the dedication of health workers and officials, but remain concerned about the silence on structural and policy issues that weaken our health system and entrench inequality. Ending TB requires more than medicine. It demands housing, nutrition, education, and economic opportunity, the foundations of human dignity. The relaunch of the TB Caucus must not be ceremonial. It must drive real leadership, oversight, and measurable action. TB is beatable, but only through prevention, collaboration, accountability, and a relentless focus on improving living conditions for all South Africans. I thank you.
The Honourable Thring.
Thank you, Honourable Deputy Speaker. The ACDP notes that South Africa's TB response reflects collaboration between the Department of Health, the National Institute for Communicable Diseases, and the National Health Laboratory Service, aiming to reduce TB incidence and mortality by 2035, with a target of testing some 5 million people annually. This ambition is technologically bold, yet institutionally fragile. Clearly, the relaunch of Parliament's TB Caucus must confront entrenched failures in oversight, funding, transparency, and rural health equity. The ACDP welcomes the Minister's recent launch of a near-live TB dashboard to track provincial testing and mortality data. However, we note that it mirrors the electronic vaccination data system, from which relevant departments failed to extract lessons on data integrity and rural service gaps. Deputy Speaker, the ACDP is aware that Parliament's TB Caucus, aligned with the Global TB Caucus, seeks to mobilize MPs in advocacy, yet its voluntary nature and lack of implementation teeth risk rendering it symbolic. The ACDP agrees that regrettably, there has not been an adequate interrogation of provincial disparities in TB outcomes, especially in under-resourced districts. Critics continue to call for performance-linked funding, auditable health metrics, and enforceable provincial accountability, none of which are embedded in the caucus's relaunch. Additionally, public commentary has questioned the silence on TB-related corruption and the absence of whistleblower protection in health oversight legislation. As kingdom builders, the ACDP commits to fighting the spread of tuberculosis, but cautions against government overreach like we saw with the irrational and some would say illegal COVID mandates. We must ensure that medical interventions to fight TB, like the promising M72 vaccine, must continue to go through the vigorous scientific, medical, and peer review processes, unlike the interventions used under emergency authorization during COVID. I thank you.
The Honourable Ghana.
Hi, Chair. I'm on the line.
Honourable Kwankwa, could I also just remind whips that they do have to inform the table so that we do have the speakers on the list. Honourable Kwankwa, please proceed.
My apologies, Deputy Speaker. We'll make sure that it's done next time. Honourable Deputy Speaker, we have on numerous occasions deliberated upon strategies to combat TB in South Africa. We have set up numerous TB prevention task teams and also had countless promises and plans in the House to cure this disease. Yet it remains prevalent in many of our communities and continues to be the largest killer of South Africans. The UDM is of the view that this caucus will produce, if we're not careful, this caucus is likely to produce the same rhetoric and is likely to do little to solve the issue unless basic foundations of healthcare delivery in South Africa are addressed. For example, the situation in the Eastern Cape is very dire. According to the Human Rights Organization Section 27, in communities such as Nileni, Chezi, Folokwe, and Mgojweni, in the former Transkei areas. Residents walk long distances across Kocha River and navigate thick bushes to reach to the nearest clinic in Kanya village, which is about 15 kilometers away from them. For over a decade, they have petitioned for a clinic of their own, but to no avail. Across the province and many parts of the country, hospitals and clinics remain under-resourced, ambulances are scarce, and healthcare workers are overstretched. Therefore, it is no surprise that the province in particular carries one of the highest TB burdens in the country. The problem facing the country in this regard is largely one of implementation and integrity rather than a policy one. The National TB Strategic Plan 2023-2028, for example, provides a framework but will only probably never see it go from ideation to full implementation, as billions meant for healthcare are siphoned away through corruption. Recently, we have all heard about the 2 billion rand that was stolen from Tembisa Hospital and the multi-million rand fraud that occurred at the Chief Albert Luthuli Hospital in Durban regarding the supply of medical equipment recently. While these crimes unfolded, precious lives that could have been saved were lost due to greed. Even though the approach will obviously need to be evaluated due to evolving times, educational health promotions like soul bodies must return. They must deliver targeted messages on prevention, adherence, and early detection. The ward-based primary healthcare outreach teams program must also be strengthened and expanded. This program could mirror the community health worker model rolled out in countries such as Ethiopia in the early 2000s. Such models will help us in areas such as BCM and many other municipalities in the country that are struggling with these problems. Digital healthcare systems should also be implemented across facilities. They will improve record keeping.
Thank you, Honourable Kwankwa. Your time has expired.
Because of that, ma'am.
Honourable Ghana, you now have the floor.
I can some Tromastolo. All of them solid. As Rising Zanzi, we commend you for shining the light on the public health crisis that is TB in South Africa. Through the End TB campaign, you have refocused the energy on this crisis. We also support the recent launch of the TB testing dashboard, which represents a significant step in ensuring that policymakers and healthcare workers have real-time data to base their decisions on. Over the last year, as you know, I have worked tirelessly to raise awareness of the public health crisis that we face in gambling addictions. Today, I join you in putting the spotlight on the TB public health crisis in South Africa. And we support, as Rising Suns, we support the relaunch of the Parliament TB Caucus. Similar to how poverty, unemployment, and lack of regulatory controls have left South Africans exposed to the gambling crisis, HIV, diabetes, stigma, and lack of awareness have resulted in South Africans being particularly vulnerable to the risk of TB. The impact has been devastating. TB has left young children orphaned, families without their breadwinners, and lives cut short before they properly began. Every year, over 270,000 people develop TB in South Africa, and every year TB claims the lives of 56,000 children, mothers, fathers, brothers, and sisters. This is a crisis, and one that is exacerbated further by the prevalence of people living with HIV and diabetes in our country. Despite this, we know that about half of people with active TB are never officially diagnosed because they show no symptoms. A lack of awareness and prevailing stigmas mean that people who show no symptoms are never screened and they unknowingly continue to spread the disease to others. We also recognize the incredible work that is done by researchers in South Africa to better understand TB in all its forms, to develop better treatments, and to develop vaccines for all. South Africa leads the world in TB research, and we must continue to support and celebrate the strides made through their research. Let our fight against TB showcase what we as South Africans are capable of, let us channel that same energy, care and resources into the fight against gambling in South Africa. Let us join hands in ensuring that every public health crisis receives the attention it deserves.
The Honourable Maimane.
Honourable Deputy Speaker, honourable members, Minister and fellow South Africans, as Build One South Africa, I want to affirm, Minister, we welcome your statement and initiatives to prevent and limit TB in our country. What is absolutely true is that 56,000 a year of our 56,000 a year of our in 1 year, 56,000 citizens are being killed by TB. More than half of the deaths are people living with HIV, showing how TB and HIV are intertwined and central to any conversation about public health care. But honorable members, I think we can announce as many initiatives as possible and have as many programs as possible. But I really genuinely want to speak about the things that undermine our ability to deliver on those programs. The first is, it is clear and common cause in South Africa we live with a two-tiered health system. One where the majority of citizens are heavily dependent on the state, and a few and a minority are dependent on the private sector. Ultimately, if we are going to achieve a sense upon which we collectively fight, isn't it about time that we become more urgent about delivering on universal health care for all? Secondly, it's common cause the fact that we are never going to win until the evil of corruption that is ravaging our hospitals is not dealt with. It should shame every single one of us as to what took place in Tembisa, and we cannot afford it to continue under our watch. And the same could potentially be happening at other hospitals. And therefore, honorable members, those who are driving around in Maseratis, those who have looted through tenders, are the ones equally so who should be held responsible for every life we lose in Tembisa through TB. Thirdly, and most crucially, honorable members, I genuinely believe that the sooner we deal with this issue of how we digitize our tender system, we can then begin to adequately deal with prevention, ensuring that every tender is digitally accounted for so that we don't have the levels of corruption that we are seeing at many at hospitals, even such as in Tembisa. Fellow South Africans, the fourth intervention I want to highlight is the notion of how we deal with primary health care. Our clinics need to be the focus of funding. We need to ensure that every South African is within a walking distance to a healthcare facility where they can get thorough diagnosis, and as the minister speaks about a vaccine, can have that administered right there closer to the people. Often, when I've been on site to hospitals, we discover quite quickly that the fault lines lie often in primary healthcare. So, Minister, I want to assure you that the fight for higher funding into the public healthcare is one that I join, so that we can ensure that the patient to doctor ratios, the nurses to patients ratio is continually declining. Let's do more than talk. Let's act to protect the poor, certainly in a time such as this one. Thank you.
Let me just make sure whether there is an ATM speaker. ATM.
Thank you very much, Sekela Statlalo Wendlu, Sekela Somlomo Wendlu. See ATM siyayamkela le progressive move esuka ku minister ingeyiyo eyokuqala. Akukhondo ibuhlungu ebomini njengokusweleka kwabantu abangathathi ntweni beswelekiswa sisifo esinakho ukunyangeka. Kungoko ke si-African Transformation Movement sithi this move is a very progressive one, but it needs enough budget from the Treasury. It needs an integrated approach with social development in terms of poverty alleviation programs, because ngelinye ixesha aba bantu basolekisa kukuba bengakwazi ukutya ipilisi kuba belambile. Kuloko ke ngoku sisithi the integrated approach, i-clinic ezilalini ezine enough resources ezotesta yona le TV zibalulekile, i-distance ehanjwa ngabantu ukuya kufumana inkonzo zempilo yabo iyaconsideriswa lonto. Iyakwenza ke into yokuba yonke le program kaminister ibe yiprogram ephumelelayo. Kuloko ke sisithi masibambisaneni sonke siqiniseke into yokuba ezi zinto ziyenzeka kuzokwehla ukutshona kwabantu okanye kusweleka kwabantu kwisifo esikwaziyo ukunyangeka. Inkosi ndiyabulela.
The Honourable Musa.
Al-Jama commends government for having made significant progress in controlling tuberculosis for the past 10 years. We have further seen a commendable increase in treatment coverage. However, TB remains a huge health challenge for South Africa with a slow decline rate in TB-related deaths. The fact that many households still face challenges in accessing care and still living in abject poverty, a major contributor to the high TB rate. Al-Jama congratulate government on the relaunch of Parliament's TB Caucus, bearing the severity of the 56,000 deaths caused by TB every year. We challenge Parliament to highlight TB at more parliamentary sittings. We must stop people from dying of TB and those co-infected with HIV. It's a disease which is curable, but yet of those infected, very few are successfully treated every year. The department's End TB campaign must be intensified. On this point, I must applaud the department's campaign as it is active, as seen at the recently held Pal Muslim Jamaa's annual Bolan Festival, which drew more than 30,000 people over a weekend. It had a TB awareness program, and festival goers were from other Bolan towns and the mother city. Al-Jama calls on the department to invest more in such awareness campaigns. This shows that TB does not only affect the disadvantaged communities, but everyone is susceptible to contacting the disease. The public must be made aware that they too play a crucial role in prevention of TB. They must be aware to recognize symptoms, be encouraged to do testings, to complete treatment and not to see it as a stigma. Along with government and its entities, we all have a collective responsibility to stop TB infections and spread thereof. To effectively ensure a successive rate in controlling the spread of TB, Al-Jama calls on government to implement the following: stronger social protection programs to strengthen the resilience of families affected by TB. TB patients must be provided with nutritious food without burdening the household income. Social protection be extended to the household and not only the TB patient. Should the TB patient be eligible for a grant, that the situation of the household be taken into consideration in addition to that of the patient. Al-Jama supports the department's call to encourage members of parliament to include awareness to stop the TB epidemic in their political campaigns. We must all, at all times, be building a caring society together. Molly Bangwe. Thank you.
The NCC. Not PAC. UAT. Good. And then it is the Honourable Tejo.
Honorable Deputy Speaker, Ministers and Deputy Ministers, Members of Parliament, our guests, fellow South Africans, good afternoon. Today marks a significant milestone in our ongoing fight against tuberculosis. As we relaunched Parliament's TB Caucus, this initiative is not just a parliamentary event, it is a renewed commitment to the health and well-being of every South African. Tuberculosis is more than a medical condition. It is a mirror reflecting our country's history, our social and economic realities, and the persistent inequalities that continue to shape our society. The story of TB in South Africa is deeply intertwined with our past. In the late 1800s, as South Africa's mining industry grew, TB became known as a miner's disease. Poor working conditions, inadequate ventilation, and overcrowding made miners vulnerable. These conditions were not accidental. They were the result of a system that valued profit over people. And that legacy continues to affect us today. TB is not just a health issue. It is a social, economic, and moral issue. It thrives in poverty and overcrowding, and its impact extends far beyond the clinic. Historically, South Africa has contributed significantly to the regional TB burden, especially through migrant labor in the mining sector. TB spreads easily, affecting families and communities, and it cannot be defeated by medical intervention alone. As we relaunched Parliament's TB Caucus, we must remember the words of President Nelson Mandela spoken on the World TB Day. The key to controlling TB is to raise awareness about its symptoms and encourage sufferers to seek treatment. It is to ensure that patients follow the full course of medication for the prescribed period. TB patients who are taking their treatment can live and work safely in the community. They need and deserve our support as they journey towards recovery. TB, like other epidemics, knows no boundaries. All nations and communities need to join hands to fight the disease. This is our challenge and our opportunity as parliamentarians. As public representatives, we must bridge gaps in TB prevention and care, raise awareness, strengthen the link from diagnosis to treatment, and ensure no patient is left behind. Our mission is to mobilize all of society towards a TB-free South Africa. Let us be clear, TB must be treated as a societal matter. The fight against TB requires a coordinated action across government, civil society, and the private sector. It demands ongoing commitment to programs that reach the most vulnerable, and it calls for innovation in research, including development of a new vaccine and medical advances. Parliamentarians have a vital role to play. We must be ambassadors, educating our communities, coordinating efforts, and fighting the stigma that still surrounds TB. We must support governments and researchers who are working tirelessly to find new solutions. We must ensure that the needs of those most affected guide our policies and programs. Let us also recognize the importance of international collaboration. TB knows no borders, and our efforts must be part of a global movement to end the disease. By working together, sharing knowledge, supporting research, we can accelerate progress and bring hope to millions. In closing, I call on every member of this House and every South African to join hands in the fight against TB. Let us honor the legacy of those who have suffered. Let us build a future where TB is no longer a threat to our people. Together, we can achieve a TB-free South Africa, a TB-free Africa, and a TB-free world. I thank you very much.
Thank you, Honourable Member. Honourable Minister, you just made it back in time. I was getting a bit worried. I wanted to put the Deputy Minister on the spot. So could you please close the responses?
Thank you very much, Chairperson. I was definitely around. It was just a call of nature. Honourable members, I think maybe it shows exactly why it was important for us to launch this campaign so that members can be abreast with events. Because I realize that there's a lot of knowledge gap. Honourable Mutuwadze from the MK party, you spoke with a lot of courage and it shows that you want TB to come to an end. But I think you have got a lot of gaps, my brother. Huge gaps. Huge gaps. Number one, you say MK party won't stop fighting for special TB centers, etc. Why are you going to get them? There's nobody in the world who's still doing that, man. We started stopping that 30 years ago. We're no longer using TB hospitals. They are not used anywhere in the world. We discourage them because we want to treat people in communities. Yes, part of the reason is because two most important things. We're diagnosing TB early. I've just told you when I was standing here that it used to take 6 weeks to diagnose TB. It's taking 2 hours now because of advances in technology, and we're the first country to introduce gene expert. Secondly, the modern treatments make sure that within a very few days you are no longer infective. TB hospitals was because we wanted to take people away from communities because they were infecting them. It's no longer like that because the world has got very advanced treatment. So we're not going to open any TB hospital. Please stop that campaign and direct it somewhere. It's not worth it. And the world will be very surprised to hear you doing that. It's not worth it. Then the issue of reparation that Mutuwadze. I don't know how you missed this, but reparation I like because yes, in 1980, around the 80s, 80% of the gold of the world came from South Africa. But we're paying the price with TB because it's mostly gold mines that produce TB because of silica dust. But this thing did not stop. You remember that there was a class action to litigate all the mine owners, especially those who produce gold, to reparate and pay mine workers, starting from 1960. And not only for South Africa, for the whole of SADC. And we called the mining companies. We called them. I facilitated that meeting and asked them that they must negotiate this issue and not go to court because they were not going to win. And together they put up what we call a Chiamiso Trust. This fund, which you call a reparation fund, it has been existing from long ago. We started long ago in 2015. We even called in a meeting facilitated by Rekhale Mamutlanti when he was still deputy president. We called ministers of mining, finance, etc. around SADC. We met in Bramfontein and we told them about this. And the mining companies agreed. It might not be enough, but they put together 5 billion rand as a reparation fund. We are now having a job to find all the people from 1960 who came to work in South Africa and contracted TB. We are looking for them in Botswana, Mozambique. We even opened special centers in Mozambique to look for those people. Our problem now is to find them. Out of the 5 billion that was put together, we said the lawyers must stand aside because otherwise they were going to take all the money. We gave them 300 million for their administrative work. Now, our struggle is to find people. There is still 2 billion rand left in Siamiso Fund, waiting for people who are going to claim that money. And unfortunately, we can't find them because 1960 is too far. Mechira, we no longer diagnose TB with microscopy. It was happening when I was still a medical student. We're using gene expert and molecular. Long ago, yes, I used to peep in a microscope. We don't do that anymore because we have advanced. And the issue of PMTCT, in 2004, there were 70,000 children born HIV positive. That number, we have brought it down to 7,000 because of successful mother-to-child transmission. So please, honorable members, let's fight this TB together and forget about which party we belong to. Thank you.
Honourable members, that concludes party responses to the statement. The Secretary will now read the first order.
Consideration of recommendation of persons to fill 3 vacancies on Electoral Commission.
The Honourable Chabane.
Thank you, Deputy Speaker and honorable members. Last week, this House reflected on the 2024 national and provincial election tabled by Portfolio of Minister of Home Affairs. This provided an opportunity to assess the performance of the Independent Electoral Commission and its leadership under the guidance of the collective of commissioners. We, this House, identified both the success achieved and the challenges encountered, and this House have provided clear recommendation for a way forward. Deputy Speaker, Parliament has deliberately chosen to stagger the tenure of IEC commissioners to avoid the wholesale changes that could result in a loss of valuable institutional knowledge. This staggered approach ensures the retention of leadership experience and institutional memory within the Commission, and institution tasked with determining policy and overseeing the effectiveness of implementation of operational and logistical functions as outlined by the Electoral Commission Act. As guided by the Act, the panel chaired by the Chief Justice of South Africa, comprising of the chairperson of the Human Rights Commission, the Commission for Gender Equality and the Public Protector, initiated a process to fill the 3 vacancies arising in November 2025. Public nominated candidates were interviewed by this panel, constituted in terms of Section 6, Subsection 3 of the Electoral Commissions Act of 1996. Following the interviews, the Chief Justice submitted a shortlist of 8 candidates, together with their curriculum vitae and recommendation to the Speaker of the National Assembly for consideration. The Portfolio Committee of Home Affairs, upon receiving this request, resolved to nominate 3 candidates to fill the IEC vacancies. In its deliberations, the committee applied a clear set of criteria, which included, amongst others, the experience of individual candidates, leadership abilities, technical competency, the stability and the cohesion of the Commission, gender representative and racial diversity. The committee accepted all 8 recommended names and expressed confidence in their suitability to occupy these critical positions. In the process of identifying 3 candidates as required, members held different views during the deliberations, acknowledging that the Commission requires capable and experienced individuals who can safeguard and advance our democracy. The committee took note of the Chief Justice panel recommendation to each candidate. However, consensus was reached on Ms. Joyce Spitzo as the first nominee, and voting was conducted for the remaining 2 positions after deliberation, resulting in selection of Judge Daya Pillay and Mr. Mosotho Moebza as the additional nominees. During the deliberations, the committee noted with concern underrepresentation of the youth and persons living with disability in the selection process undertaken by the panel. Accordingly, the Portfolio Committee recommends that Section 6, Subsection 3 of the Electoral Commission Act be amended to include the National Youth Development Agency in the interview panel for IEC commissions appointments in future. Ms. Joyce Spitzo, deeply rooted in civil society and had extensive experience observing election internationally, her role in SADC and UN will bring valuable perspective in the South African electoral system. Judge Pillay has wide experience in electoral spheres and judicial experience in a labor court, high court, and constitutional court, and she has served at the commission for 7 years. Mr. Mosotho Moebza, having served IEC in various disciplines over a period of 27 years, his experience was demonstrated at the testing period during the 2021 COVID elections, presiding over the 2024 election on the new electoral regime,
a former president of the World Election Board and currently chairperson of the Election Commission Forum in SADC. The two returning commissioners, Deputy Speaker, will ensure continuity and retention of critical institutional knowledge, while the new commissioner will bring fresh perspective and innovation insight to strengthen the commission. The IEC has consistently demonstrated its resilience under the leadership of commissioners, and the addition of these recommended commissioners will further consolidate the capacity and enhance election work in the current complex electoral landscape. House Chairperson, the Portfolio Committee hereby therefore submit this report for considerations and approval by this House. Nakens.
Thank you, Honourable Member. I will now recognise parties wishing to make a declaration. The usual times for declaration of votes will apply. The DA.
Thank you, Deputy Speaker. Today we are called upon to fill 3 upcoming vacancies in one of the most vital institutions of our democracy, the Electoral Commission of South Africa. The Democratic Alliance supports the nomination of Judge Daya Pillay, Mr. Mosotho Moepya, and Mrs. Jabu Pitsu to fill the 3 vacancies. Before we turn to the merits of these candidates, we must first address the unsubstantiated falsehoods being peddled in this House. We have heard some members claim alleged election rigging of the 2024 elections. Let's be absolutely clear. These allegations were taken to court and then withdrawn. Withdrawn, Deputy Speaker, because there was no evidence. In fact, the Electoral Commission wanted to proceed with the matter, to hear the claims and see the evidence to address the matters raised. However, the claims that were so loudly made in the public space were not supported by evidence. And if those parties truly believed their own accusations, they would have pursued them. Instead, they quietly withdrew their case and now seek to mislead Parliament to score political points. In committee, it was then claimed that Mr. Moepya and Judge Pillay should not be reappointed because of alleged failures to oversee free and fair elections. And it is disgraceful to attack the integrity of the IEC and its commissioners without evidence, because when you do that, you don't just harm the individuals and their reputation, you undermine the very institution charged with free and fair elections. Deputy Speaker, the facts are these. A panel chaired by the Chief Justice, including the heads of the Human Rights Commission, the Commission for Gender Equality and the Public Protector, ran a transparent and independent process to find suitable candidates. They received 77 applications, shortlisted and interviewed candidates publicly, and recommended 8 names to Parliament. Among them were Judge Pillay, Mr. Moepya, and Mrs. Pitsu, all of whom were found suitable and qualified. Mr. Mosotho Moepya, the outgoing chairperson, has led the IEC through perhaps the most complex election in our democratic history, the 2024 national and provincial elections. He guided the commissions through new territory, with independent candidates contesting national and provincial elections for the first time. Those elections were declared both local and international observers as free, fair, and credible. That is the real record of his leadership, not the baseless claims now being recycled by sore losers. Judge Daya Pillay brings a wealth of judicial experience from the Labour Court, the High Court, and the Constitutional Court. She has shown both a strong grasp of law and a passion for dispute resolution and efficiency in the IEC's operations. Her judicial background ensures that the Commission remains rooted in fairness and constitutional principle. Mrs. Jabu Pitsu represents renewal and innovation. With her extensive experience in the IEC, observing elections across Africa through the United Nations, and her experience with electronic voting systems, she will bring international best practice and a deep understanding of voter participation and electoral technologies. The selection panel described her as, and I quote, an outstanding candidate, and her unanimous support in this committee is well deserved. Her energy and passion for electoral reform will strengthen the Commission's ability to modernize and reconnect with voters, especially the youth. Deputy Speaker, the IEC faces major challenges: restoring trust, tackling voter apathy, and preparing for the next elections in a coalition era. To succeed, it needs continuity, institutional knowledge, and fresh ideas, not political theatre. This is exactly what Pillay, Moepya, and Pitsu bring to the table: the judicial integrity of Judge Pillay, the institutional experience of Mr. Moepya, and the innovation and energy of Mrs. Pitsu. Together, they form a strong and balanced team to contribute to the Commission and take it into the next chapter of our democracy. Let us build and strengthen our institutions, because when our institutions are run by capable and committed South Africans, our democracy stands with them. I thank you.
Thank you, Honourable Member. MK.
Honourable Deputy Speaker, before I get into my speech, let me emphasize the election was rigged. The election was rigged. The transparency is being denied. Umkhonto weSizwe Party rises as an official opposition to defend something far bigger than party interest, the integrity of our vote. An election is only legitimate if citizens trust the referee. In South Africa, the referee is the Electoral Commission, not the independent, but the Electoral Commission, because this Electoral Commission is no longer independent. If the referee is compromised or even seen to be compromised, our democracy bleeds confidence and participation. Let's be clear about the stakes. The IEC record is not spotless. In Electoral Commissions versus Mhlophe in 2016, the Constitutional Court held that the Commission failed to obtain and record voters' addresses required. A lapse so serious, the court had to craft a remedy to prevent mass disenfranchisement. That is not a footnote, it is a constitutional censor of the very institution we are told to trust. And when the panel was asking Mr. Muyepa about this, he was a denialist in the interview. It's on the transcript of the panel. Fast forward in 2021, the new VMD buckled during a key registration weekend. The IEC itself acknowledged mapping failures on the devices. Those same system failures carried into 2024 with research and election watch bodies warning about device errors and human factor risk when technology that underpins the role and special voting stumbles, public confidence takes a hit. During the 2024 national and provincial election, the results portal leaderboard went dark for roughly 2 hours in the middle of counting before the IEC restored it and insisted that glitches didn't affect results. Parties lodged hundreds and hundreds of objections. The IEC pressed ahead to declare elections on schedule. You cannot run a democracy on trust us. While the scoreboard blanks out and objections pile up, transparency must be earned in real time, not explained after hours. ANC has failed dismally on being transparent with the IEC. Honorable Speaker, MK's own experience underscores the problem. In 2024, the IEC pushed legal processes that directly shaped the participation of our leadership and candidates, first losing in the Electoral Court, then persisting all the way to the Constitutional Court. Whether one agrees with the ultimate Constitution Court outcome or not, the perception is lethal. Too many South Africans now believe the IEC moves in political synchrony with the ANC and pursues outcomes that favors the establishment. A referee cannot be prosecutor and a player, and certainly not proxy for any party. This is not personalities, it is about the patterns. There's a lot that the panel said against, especially one candidate. We support other candidates, we support Ms. Pito, we even support Judge Pillay, but we hate people who just sit there being deadwood, denialist, not transparency, and doesn't accept faults. And the panel said they doesn't offer any solutions. As MK Party, we reject this report because these people are now denialists. They are hogging the
Thank you, Honourable Member. Wow, your time is now expired. The EFF.
House Chairperson, we want to state from the outset that the economic freedom fighters
supported the name of Mrs. Pitso and rejected the names of Mr. Mosotho Moepia and Judge Pillay. These two names were supported by the ANC and its GNU partner, the DA and the IFP. Although the EFF has never contested the outcome of any election, we have consistently raised concern about the IEC glaring failures, from the dysfunctional VMDs to its inability to register more voters and the consistent discrepancies in the capturing of result slips, where votes are swapped to the benefit of the DA and the ANC. In our post-election audit, we discovered more cases of EFF votes being wrongly captured by the IEC across the country. While the DA and the ANC were allocated more votes than they received, when we raise these discrepancies in the capturing process, they are dismissed with arrogance. If this is not attended to, it has the potential to plunge this country in serious post-election violence. We have never remained silent when the ANC deployed questionable individuals such as Mashinini, Tlakula, Janet Love, and now Mosotho Moepia and Judge Pillay to the IEC. Our rejection of Mr. Moepia and Judge Pillay is based on the finding contained in the panel report chaired by the Chief Justice. On Mr. Moepia, the panel stated that the panel was concerned that he came across as defensive and would not admit any weaknesses when asked about the challenges within the institution. It further observed that Mr. Moepia briskly dismissed suggestions made by another candidate on improving the commission systems and appeared to lack the willingness to accept the inputs of others and the soft skills of empathy and sensitivity required in a leader. The panel concluded that it was concerned that Mr. Moepia could not put forward any ideas on how to address institutional weaknesses, including the well-documented voter apathy in the country. On Judge Pillay, the panel noted that it was rather concerned by her defensiveness and reluctant to admit the challenges within the IEC during her tenure. Her position relating to the diversity of South Africa and dealing with voter apathy was not entirely satisfactory. The panel was clear that these two candidates would not offer any meaningful solutions to address the growing problem of voter apathy and the high number of unregistered eligible voters. South Africans must question why the ANC and its GNU partners chose the least recommended individuals and ignored highly skilled individuals like Mr. Abrams. Parliament must not ignore or second guess the Chief Justice and her panel, as we did not interview
your time is now expired. Thank you.
We reject this report.
The IFP.
Thank you, Honorable Chairperson. When South Africans cast their votes in 2024 national and provincial elections, they were not only entrusting political parties with the responsibility to govern, but were also expressing their confidence in the IEC's processes and the integrity of our electoral system. Therefore, the appointment of commissioners who are truly fit for purpose is a matter of national importance, one that demands integrity and a firm commitment to impartiality over partisanship. Thus, the issue before us is not just about appointments. It is about safeguarding of our democracy. The IEC stands as a guardian of our persons' voices, and any weakness is its structures, strict public distrust in elections. Voter confidence in the IEC has declined over recent years, particularly among the youth. This growing apathy must concern us all. The IFP therefore welcomes the recommendations to include NYDA in the future selection panels. Youth and persons with disabilities must see themselves reflected in the nation's democratic institutions. In light of issues raised The IFP supports the report. I thank you.
Thank you. The PA.
Thank you, Chairperson. The Patriotic Alliance, no declaration, but we do support.
The FF Plus.
Thank you, House Chairperson. In April 2025, the Office of the Chief Justice published a notice calling for nominations to fulfill 3 vacancies on the IEC. The initial deadline for submissions was set for 16 May, but was later extended to 6th of June. In a statement issued on the 18th of June, the Office of the Chief Justice announced that the selection panel chaired by the Chief Justice include the chairperson of the South African Human Rights Commission, the chairperson of the Commission of Gender Equality and the Public Protector. The panel compiled a short list of 12 candidates to be interviewed. Members of the public were invited to submit comments on the suitability of the shortlisted candidates by the 9th of July. The report before us shows that after the interviews were concluded, the Chief Justice submitted a short list of 8 candidates to Parliament for consideration. The Portfolio Committee on Home Affairs accepted all 8 names of these candidates. Although all the candidates have met the required standards, it is the responsibility of this House to appoint 3 candidates as commissioners. The FF Plus agrees with the committee that the responsibilities of the Electoral Commission demand experienced and capable individuals. Just last Thursday, this House debated the serious problems that occurred within the IEC during the 24 national and provincial elections, issues that caused great frustration amongst voters. The FF Plus made it clear last week that we cannot and must not allow that the public lose confidence in our democratic system, and that we must do everything in our power to see to it that the IEC perform its duties without any complications, and that experienced and capable appointments be made to fulfill these duties. I thank you, House Chairperson.
Thank you, Honourable Member. Action SA.
Thank you, House Chair. Honourable House Chair, Action SA welcomes the opportunity to engage the recommendations for the appointment at the Independent Electoral Commission. We recognise the integrity of the process led by the Chief Justice and the multi-institutional panel, which ensured that merit, experience and ethical fitness remain central to these deliberations. We note the committee's efforts to ensure experience, leadership and technical competence while striving for representativity that mirrors our democracy. In this spirit, Action SA strongly supports Ms. Joyce Pitso, whose credentials reflect the grounded, capable and ethical leadership that the IEC urgently requires. Ms. Pitso embodies administrative discipline, impartiality and a commitment to service that can restore the Commission's credibility. She represents the generational and gender renewal that South Africans have long called for. We also acknowledge the experience of other nominees, particularly Judge Pillay, whose judicial insight and principled record are beyond question. Yet, renewal cannot be continuity for its own sake. The moment demands new thinking, independence, and a visible break from practices that have eroded public trust. Ensuring continued faith in the IEC begins with cleansing it of political capture and entrenched ANC cadres. And it is in this spirit that we must register our disappointment at the prospect of Mr. Mosotho Moepa's return to the Commission despite unresolved past misconduct allegations. Our democracy deserves an electoral body that is fiercely independent, inspires confidence across party lines, and serves only the people of South Africa. We must also note the lack of youth representation in these appointments. Young people like myself must see themselves reflected in these institutions that protect their vote. Action SA supports those who deliver renewal and calls for greater inclusion of younger nominees in the next round of appointments. Thank you very much, House Chair.
Thank you. The next speaker is from the ACDP.
House Chairperson, we all know how important the Electoral Commission is in keeping our democracy fair and functional. That's why the process of filling these 3 vacancies matters so much. It cannot be just about ticking boxes. It's about protecting public trust. The Portfolio Committee on Home Affairs has put forward 3 names to replace outgoing commissioners, including the chairperson. The Chief Justice led the selection process as required by law, but it is Parliament's job to make sure that those appointments are solid, independent, credible, and above reproach. People are asking why Parliament hasn't spoken up about the IEC's budget problems or the logistical mess in recent by-elections. Unfortunately, there's been real concern that Parliament hasn't done enough to check political ties or past conduct. The process felt rushed. Public input wasn't properly considered. Over the past year, the ACDP has pushed for clear criteria, merit-based appointments, proper vetting, and full transparency. Whilst the committee felt that these candidates have the skills, experience, and capacity, they mean nothing if the candidates are not impartial. If we want the Commission to stay neutral, Parliament must step up and do more than just rubber stamping. Oversight isn't optional. It is our constitutional duty, and we must make sure that the IEC remains respectable in the eyes of the public. Thank you.
Thank you, Honourable Member. The UDM. Rise.
Thank you, Honourable House Chair. In consideration of the Commission's mandate, all three candidates, Mrs. Pitso, Judge Pillay, and Mr. Miepa, displayed knowledge for electoral systems and an understanding of the Commission's mandate and value to South Africa's democracy. The UTM notes that Judge Pillay and Mr. Miepa have wide experience in the electoral sphere and electoral management as outgoing commissioners who served in the last term of office. However, we are concerned about the recycling of leadership in these commissions, even those with the darkest cloud of scandals hanging over their heads. Appointing the same candidates consecutively when they are qualifying new minds willing to serve is not fair. Yes, having experienced candidates is vital, but we need to also create a space for new visionaries with innovative ideas and solutions to resolve the Commission's challenges. Also, we are concerned with the issue of age that was totally disregarded in the nomination process. There is no youth representation amongst the recommended candidates, and this is concerning given that already we have a crisis of youth voter apathy in the country. One of many reasons young people feel alienated from formal politics is because of the underrepresentation, and having an electoral commission that does not represent them might be a bad sign into resolving this alarming youth disengagement in elections. The Commission needs a youth representative to implement youth-based strategies and long-term solutions to curb voter apathy.
Honourable Member, your time is now expired. Thank you.
Thank you.
Rise.
Now, we rise to support the committee report recommending the appointment of Mrs. J. Pitso, Judge Pillay, and Mr. Miepa as commissioners of the IEC. As we approach the upcoming local government elections, the work of the IEC has never been more crucial. Our democracy depends not only on the right to vote, but on the assurance that every vote counts freely, fairly, and transparently. The Commission must therefore ensure thorough preparations from voter registration and logistics to ballot security and the training of electoral staff. Equally important is the accessibility of the electoral process to monitors, observers, and the media. Transparency builds trust, and trust sustains democracy. The IEC also carries the responsibility of implementing and enforcing the Political Party Funding Act, a cornerstone of clean and accountable politics. Voters must know who funds those who seek to lead them. In this new chapter, the IEC must remain independent, impartial, and fearless in its duty. Let us support the Commission as it safeguards the integrity of our elections, which is the heartbeat of our democratic nation.
Thank you, Honourable Member. Bosa.
Honourable members, the oldest president in the world has just been elected. Paul Biya of Cameroon has won his election. It's very clear the fact that that election was not free and fair. It's very clear that the opposition had in fact won that election. But the Constitutional Court, as it happens in many instances, bowed to political pressure and declared Mr. Biya the president of Cameroon. We can proceed and ask the questions in Zimbabwe, where we see elections are not free and fair. We will recall the elections in Malawi, where TIPEX was being used to change the election results. We can remember the elections in Mozambique and how much violence took place in those elections. I raise these examples to demonstrate that democracy is fragile in the continent. And therefore, as this House, as we appoint these commissioners, we must recognize that we are not immune to democracy being vulnerable. And therefore, to the three that are being nominated today, I have a few strong messages of encouragement to you. The first is this: stand up to political power, no matter what the cost is. Because the truth of the matter is that we are vulnerable. Secondly, to the judge, make sure that the institution that is the IEC is protected, capacitated, and well-funded. Our democracy resides and depends on the IEC. We can underfund it, end up with shambolic elections, which will be questioned and will lead this country down a path we don't want to go. The third is this: I am concerned that some of the administrators are now becoming commissioners. We must be careful of that practice. It blurs the line between executives and accountability. So let us support this report, but let's make sure the integrity of the IEC remains intact, or our democracy will falter. Thank you very much.
Thank you. ATM. Al-Jamaa.
Malibongwe. Honorable Speaker, Al-Jamaa Party welcomes and supports the recommendation of persons to fill the 3 vacancies on the Electoral Commission. We take this opportunity to commend the world-class, experienced, strong leadership chaired by the amazing former chair of IEC for his unwavering professionalism, integrity, and commitment to strengthening our democracy. Over the years, the Commission has proven itself as an independent, credible, and efficient body, ensuring that the voice of every South African is heard and respected at the ballot box. Viva the former IEC chair. We have full confidence that the recommended commissioners will uphold the same principles of transparency, fairness, and accountability that have made the IEC one of the most trusted institutions in our country. As Al-Jamaa, we reaffirm our commitment to working with the IEC in safeguarding the democratic process and ensuring that future elections continue to reflect the true will of the people. I thank you. Malibongwe.
Thank you. The NCC, the PAC, the UAT, good, the ANC.
Honourable House Chair, honourable members, the ANC rises to firmly support the table reports of the Portfolio Committee on Home Affairs on the filling of vacancies within the IEC. We speak in the month of October, the birth month of Comrade Oliver Tambo, the humble architect of our democratic order, who taught us that freedom must be defended daily in law and in conscience. He reminded us that the strength of the nation lies not in its comfort, but in its commitment to justice. It is also fitting that I rise to deliver this contribution in South Africa's Pride Month, a celebration of freedom and diversity. That I do so as a young queer woman of this generation is in itself proof that democracy is alive, that the promise of the Constitution belongs to all of us. This is the South Africa we so struggled for and which we continue to fight. The IEC derives its mandate from our Constitution as one of the Chapter 9 institutions that safeguard democracy. It is accountable to this Parliament and through us to the people of South Africa. Our duty is not to defend it uncritically, but to exercise vigilant oversight, to protect its independence, insist on accountability, and ensure it continues to serve the people faithfully. Honourable House Chair, the IEC is not just an institution, it is an inheritance. It is the thread that holds together the will of the people, the promise of 1994, and the soul of our democracy. It is the ANC, the liberation movement that turned the dream of freedom into a living democracy that continues to defend the institutions that sustain it. The 2024 elections reminded us that strong institutions require constant vigilance. We saw excellence, but we also saw strain. We do not deny the last elections tested the system, but democracy matures through correction and not collapse. We echo the recommendations made by this committee to the IEC that it strengthens the systems, builds stability, and enhances capacity for the future. Indeed, the 2024 elections were not without challenges, but our response must be to improve, not to undermine, to reform and not to destroy. It would be ironic if it were not tragic that those who swear by their seats in this House are the first to cast doubt on the credibility of the very vote that put them here. Our confidence in the IEC has never depended on how things turn out for us, but on how it faithfully reflects the will of the people. Even when the results have been sobering, the ANC has accepted them with discipline because we trust the process and we trust the people. We remain comfortable that within a fair and credible system, we will recover lost ground, not through noise or conspiracy, but through work and reconnecting with the people. Defending the IEC is not about defending individuals. It is about defending the sanctity of the vote and the legitimacy of our democracy. We therefore reject with absolute clarity any attempt to undermine, delegitimize, or destroy the IEC for short-term political gain. You do not strengthen the democracy by attacking its referee. You do not build trust by spreading cynicism. Those who weaponize doubt against our electoral system must know, Niyabono, we see you, and we will not allow your politics of suspicion to erode what so many sacrificed their lives to build. The process of filling these vacancies is not only administrative, it is about safeguarding the institutions that safeguard our freedom. And as the ANC, we are guided by the principle of continuity and recommitment. Continuity to preserve institutional memory and experience, recommitment to bring in new capacity, new ideas, and renewed energy for battles ahead. In that spirit, we support the nominations of Mrs. J. Pitso, Judge D. Pillay, and Mr. M.S. Muyepa, confident that they possess the necessary skill and commitment to strengthen the IEC for the future. At the same time, House Chair, we recognize the call for generational renewal. South Africa has a young democracy, and so are the majority of its voters. If we are serious about addressing youth apathy, our institutions must begin to reflect the diversity and energy of this generation. Bringing in younger commissioners and future appointments will inspire confidence among young South Africans, many of whom feel disconnected from the democratic process. When young people see themselves represented in the spaces that protect their right to vote, they will be more inclined to protect that right themselves. As the ANC, our support does not end with appointments. Oversight does not end with vote. We expect excellence, transparency, and fairness. The credibility of our democracy depends on it. Honourable members, around the world, democracies are under siege, not from coups or guns, but from misinformation, manipulation, and mistrust. The erosion of public confidence begins subtly with whispers that elections cannot be trusted. South Africa will not follow that path. We must guard the IEC jealously, not because it's flawless, but because it is foundational. To weaken it is to weaken democracy itself. The ANC does not defend the IEC against the people. We defend it for the people, because when our people enter the voting booth, they must know their voice matters. When results are declared, they must trust the outcome, not because we say so, but because the process is credible and the institution is strong. That is the democracy we fought for. That is the democracy we must now protect, and that is the democracy we will continue to build, brick by brick, generation by generation. The ANC supports this report as a recommitment and reaffirmation of our collective duty to guard the institutions that keep the flame of freedom alive. We stand for vigilance, we stand for accountability, we stand for democracy that cannot be bought, bullied, or broken. Thank you.
Thank you, Honourable Member. Order. Thank you. Thank you. That concludes the declarations. The question before the House is the adoption of the report of the Portfolio Committee on Home Affairs which recommends, amongst other things, the approval of the nominations for appointment as electoral commissioners of Mrs. J. Pitso, Judge D. Pillay, and Mr. M.S. Oyopia. Are there any objections to this recommendation? Yes, Honorable Member.
Thank you, House Chair. The EFF rejects and we are calling for a division.
A division having been called, the bells will be rung for 5 minutes.
We're voting candidate one by one. So Botelo Miepe once, Botelo one by one.
Check. Yabo. Mouse pad down. Walk the la. Walk on the
Order, honorable members, will you take up your allocated seats? Order, honorable members. Honorable members, the Speaker has determined that in accordance with the rules, a manual voting procedure will be used for this division. In order to establish a quorum, I would request the table to confirm that we have the requisite number of members physically present in the chamber and on the virtual platform to take this decision. Party whips will then be given an opportunity to confirm the number of their members present and indicate if they vote for or against the question. A member who wishes to abstain or vote against the party vote may do so by informing the chair. Having confirmed that we have the requisite quorum, we will now proceed. The question before the House is that the House approves the nominations of Mrs. J. Pitso, Judge D. Pillay, and Mr. M.S. Muepia for appointment to serve on the Electoral Commission in accordance with Section 6, subsection 2, paragraph C of the Electoral Commission Act 1996. Voting will now commence. The doors to the chamber will be locked and members will not be allowed to enter the virtual platform until voting is concluded. I will now request the whips to confirm the number of the members present in the chamber and on the virtual platform, and also indicate if they vote for or against the question. The ANC.
Thank you, House Chair. House Chair, we have 103 on virtual and 35 physical. That's in the House, for a total of 138 in support.
The DA.
Thank you, House Chair. 19 members in the House, 59 online. That's a total of 78 voting in favor.
MK.
Thank you, House Chair. We've got 25 online, 16 members physically present. We are 41 in total voting against. Thank you.
EFF.
Thank you, House Chair. We are 21 online, 10 in the House, and 31 voting against.
The IFP.
Thank you, Chair. The IFP is voting for. Online 7, in House 5, in total 12. Thank you. We are voting for.
The PA.
Thank you, House Chair. Patriotic Alliance, 4 in the House, 4 in the platform, 8 voting in favor.
The FF Plus.
Thank you, House Chair. The FF Plus is 2 in the House, 2 online. That's 4 voting in favor.
Action SA.
Thank you, House Chair. Action SA 2 in the House, 1 on the online platform. That's 3 in favor.
The ACDP.
Thank you, Chair. We are 2 in the House, 1 online in support. Thank you.
Thank you. The UDM.
2 online, we abstain.
Order. Honorable members, order. Order. Honorable member, can you just repeat what you said? Order, honorable members.
House Chair, we are 2 on virtual and we are abstaining.
Thank you. Rice.
1 here in the House and we support.
Bosa.
1 in the House and we support.
ATM. Al-Jama.
Honorable Speaker, 1 in the chamber in favor. Al-Jamar.
Thank you. The NCC,
Malibongwe.
the
Chairperson, Chairperson NCC, 1 online, voting against. Thank you.
the PAC. Order, honorable members, you make it a little bit difficult for us to follow the proceedings, and these votes we're dealing with a constitutional matter here in terms of the Electoral Act. So let's not take it so lightheartedly. Let's go through the process without any disturbances so that we can get the correct voting numbers in. The PAC, the UAT, good. Is there any member, order, honorable members? Is there any member that wishes to abstain or vote differently to their party? There's none. Thank you. The voting session is now closed. Order, honorable members, the outcome of the division is as follows. Order. Order. There's 2 abstentions, 73 voted against, 249 voted in favor. The question of the nominations of Mrs. J. Pitso, Judge D. Pillay, and Mr. M.S. Moepia for appointment to serve on the Electoral Commission is accordingly agreed to in terms of Section 193, subsection 5 of the Constitution 1996. Question is thus agreed to. The Secretary will read the second order.
Consideration of report of Portfolio Committee on Higher Education on appointment process of chairpersons of Sector Education and Training Authority, Setas, Accounting Authority.
I now invite the chairperson of the committee, the Honorable Letsia, to introduce the report.
House Chair, honorable members, we present to this August House this report which details the committee's oversight on the appointment of SETA Accounting Authority chairpersons by the former Minister of Higher Education and Training, Dr. Nobuhle Ngabane, ensuring the process adhered to the principles of transparency, accountability, and good governance. The oversight was conducted in line with the committee's constitutional mandate under Section 55, subsection 2 of the Constitution of the Republic of South Africa and Rule 227 of the National Assembly Rules, which requires Parliament to ensure accountability and maintain oversight over the executive. In executing our mandate, the committee conducted a thorough assessment of the appointment process. Meetings were held with the former minister, head deputy ministers, department officials, and members of the Independent Selections and Evaluation Panel on Friday 30 May, Wednesday 4 and 18 June, on Friday 18 and Tuesday 22 July 2025. During the initial presentation on Wednesday 30 May, the former minister outlined the powers under Section 11, subsection 1, subsection A of the Skills Development Act of 1998 to appoint SETA chairpersons after consulting with the National Skills Authority. A notice inviting nomination was published in the Government Gazette, and the Selection and Evaluation Panel independently assessed 573 nominations against the National Qualification Framework criteria. The committee requested disclosure of panel members' names and profiles, their roles, attendance, and correspondence with the minister. All panel members appearing before the committee took an oath or affirmation in accordance with the parliamentary rules, ensuring accountability and transparency. transparency. Despite these measures, the committee identified concerns, including limited panel independence, mismatches between candidates' qualifications and sector requirements, and incomplete transparency regarding some panel members. Subsequent meetings highlighted further challenges, including delayed responses, partial disclosure of panel members' names, and justifications for absences. Nevertheless, the committee maintained its oversight, obtaining documentation, engaging panel members, and confirming its legal mandate to continue oversight. The committee's work reflects its steadfast commitment to accountability, transparency, and good governance. Despite these challenges, it examined all relevant documentation, engaged directly with panel members, and rigorously followed due process. We also note and appreciate the former minister's engagement and her commitment to recalibrating the appointment process to strengthen confidence, integrity, and governance between the PSET sector. The review identified areas requiring improvement, particularly regarding transparency, panel independence, and alignment of candidate qualifications with sectors they are appointed to serve. These lessons must inform the recalibrated process to ensure credibility, fairness, and accountability. As we await the announcement of the new Setas Accounting Authority chairpersons, the committee expects that all applicants will be treated fairly and equitably. We further trust that the current minister, Mr. Buti Manamel, will ensure departmental officials have the necessary space to execute their duties in line with policy and legislative framework. Honorable members, the committee is confident that this report will guide Parliament, the department, the minister in ensuring a transparent, a fair, accountable appointment process, contributing to a credible, a well-governed post-school education training sector for all South Africans. And I repeat, honorable members, the committee is confident that this report will guide Parliament, the department, and the minister in ensuring a transparent, a fair, and accountable appointment process, contributing to a credible and a well-governed post-school education and training sector for all South Africans. This is a fair report, and we hope that members will take it. Thank you very much.
The DA. Order, honorable members. Order, honorable members.
House Chairperson, committing fraud and a statutory offence under Section 26 of the Powers, Privileges and Immunities of Parliament and Provincial Legislatures Act 4 of 2004 is not only a spit on the graves of the forefathers of this democracy, but is a spit in the faces of this and future generations of young people who depend on well-functioning Setas for skills development. Skills that are for most their only shot at fairly competing for jobs in this constrained economy. A job, if secured, is their only shot at putting food on the table, clothes on their backs, a roof over their heads, and dignity for themselves and their families. It is a spit in the faces of the dedicated D-head staff and whistleblowers who wake up every day and go to work to make this republic work. An act of service which, for those who dare oppose being used as corruption pawns, comes at a great risk. The risk of unemployment, poverty, and the forced abandonment of their children's future. Dr. Nobuhle Nkabane and the ANC sacrificed this staff, young people, and the Republic of South Africa at the altar of their self-indulgence, the protection of a network of patronage, and the revolution's favorite elites, cadres. The appointment of failed ANC politicians, cadres, their children, and spouses as chairpersons of Seta boards was not a mistake. Dr. Nkabane and the ANC orchestrated these appointments deliberately with the sole aim of milking the state dry, which quite frankly is the people of this republic's money. These appointments followed a culture that has become primary nature for the ANC. Looting, deceit, fraud, and treating the people of this country as fools. See, integrity and financial purity are foreign concepts to the once upon a time liberation movement. And so the DA's fight against these appointments was a declaration of war against anyone and everyone who thinks the criminal and political capture of the state's bureaucracy is normal. It is not normal. It is disgusting, it is anti-democratic, and it is simply not welcome, and certainly not under my watch. We celebrate the firing of Dr. Nkabane and look forward to the outcomes of the Hawks investigation into the case the DA laid against her. But this didn't change much. Instead, her successor, Minister Buti Manamela, took right where she left off. At his first opportunity to do and be better, he appointed even more shady and compromised cadres as administrators of the LG Seta, the construction Seta, and the services Seta, some of the worst performing Setas in this department. He appointed Ndate Upangwane, a former municipal manager at the Mfuleni local municipality, who's implicated in a comparative forensic report that details the mismanagement of 872 million rands of this country's money. Mr. Lehloko Nolo Masoga, a former ANC Limpopo MEC and deputy speaker, who's implicated in a Mara forensic report for backdating a communications contract worth 4.4 million rands as the CEO of the Messina Mercado Special Economic Zone. Former Deputy Director General responsible for skills development in the Department of Higher Education since 2017. A man who oversaw the destruction and collapse of 21 Setas for the past 8 years. 8 years of damning AG reports after report, SIU investigations, forensic reports that detail acts of corruption, fraud, and the mismanagement of public funds. See, but the real elephant in the room remains. The current National Skills Authority is the same NSA that approved Minister Nkabane's previous Seta board chairpersons of ANC cadres. They saw nothing wrong with the appointment of Gweda Matasha's son and others as Seta board chairpersons, which combined oversee 20 billion rands that belongs to this country's taxpayers. The same NSA now approved Manamela's new batch of cadres, and all of these red flags are simply overlooked. Now, how can we, in all honesty, tell the people of this country that there's nothing wrong with Minister Manamela and Honorable Nkamane's NSA? We can't cry the beloved country. Our democracy is under attack.
Order, honorable members. Order, honorable members. Please proceed, honorable member.
Thanks, Chair. House Chairperson, I do not know what the Chairperson of the Portfolio Committee was saying before this House. Let me greet the people of South Africa. Emva kokuba sibona imhlolo yafika emehlweni ethu ngomhla ka 13 May ngokuphuthuma sabhalisa lo Portfolio Committee Sifuna izimpendulo kungqongqoshe wangaleso sikhathi uDr Nkabane. Sasingafuni kuphela izimpendulo kodwa sasifuna ukucacisa futhi ukuthi asihambisani nensambatheka esasiyibona uma yayiqiniswa ngaleso sikhathi. Upon us vehemently rejecting the Setas chairpersons list, which were filled with ANC-aligned individuals, including the son of Gwede Mantashe, and it must be noted that the minister, Dr. Nkabane, once served as the deputy minister of Mr. Mantashe before assuming the position of the Minister of Higher Education and Training. Amongst more than 200 qualified candidates, it is no coincidence that Umntana kaMnumzana uMantashe was selected amongst 20 other questionable individuals, 90% of whom are known failed leaders of the ANC. This risks the political nepotism and cadre deployment at the expense of deserving young South Africans. As Umkhonto Party, we remain firm that the sector education and training authorities are no playground for children of ministers or relatives of the comrades. By the way, these are not amaplas lana awu babu Mantashe abadlala kuwama quad bikes nengane zabo bese babathembisa bethi mntanami you can be a chairperson. These institutions carry a critical mandate to skill up, transform the lives and the hopeless and unemployed people across this country. Former Minister Dr. Nkabane deliberately misled and lied to the Portfolio Committee and by extension Parliament. She failed to demonstrate transparency when she refused to explain the process she used to headhunt and to assemble the so-called credible panel, and that shortlisted and recommended the NC-aligned individuals, many of whom have corrupt clouds hanging over their heads. Some of those appointed did not even meet the minimum requirements nor the experience required. Her failure to appoint Setas board chairpersons has plunged governance into chaos. Out of the 21 Setas, several remain without fully appointed CEOs, despite candidates having passed all required legislative stages. As if that crisis is not enough, Mr. Manamela, the new minister, on his very first assignment, unprovokedly placed 3 larger Setas under administration. The legislation he claims to have invoked contradicts the conditions which were actually presented. Through the Portfolio Committee, we have formally requested details of the process he followed to put these Setas under administration, including the resolution and recommendation from the National Skills Authority, which is legally mandated to advise the minister. More than 30 days later, still no response from the new minister. We also requested clarity on the selection process of the appointed administrators, 2 of whom are deeply compromised. One is implicated, as the latter member has indicated, in an almost 900 million financial mismanagement forensic investigation, while the other oversaw all 21 Setas and failed dismally. Yet the new minister saw it fit to entrust him to even a greater power of overseeing single-handedly one of the Setas. The minister has alternatively had an alternative and a more responsible option to appoint boards, chairpersons across all Setas, restore governance, enforce consequence management, and prioritize appointment of the new CEOs. Instead, the end of September, as at the end of September, the contracts of 20 Seta CEOs had lapsed, deepening the leadership and administrative vacuum. Meanwhile, the department itself is in severe decline. It has failed to meet nearly 70% of its performance targets. It has underspent 5 billion worth of skills development. It has underspent billions more in infrastructure development. It has a director general that is implicated in fraud and corruption charges, or rather fraud and corruption allegations since last year, November, till to date. The former minister and the current minister has done nothing about it.
Member, your time is now expired.
Thank you, Chair.
Thank you. The EFF.
Allow us to congratulate our Queen, Kawekazi Mazaleni, on being crowned Miss South Africa. May she inspire millions of young women and children in her reign and beyond. Chair, a lot has been said about the corruption in the Setas and the minister's insistence to deploy his friends and comrades into the Seta boards. The people of South Africa now know that this government has no plan to rescue the skills development program of our nation. Be that as it may, we'll come back to this discussion as we've got 2 or more reports that await the matter. We're also aware of Minister Manamela's nefarious plan to dissolve the NSFAS board in order to put his dirty hands on the 50 billion rands meant to fund higher education in South Africa. His friends must tell him that we're waiting.
Honourable Member, will you just take your seat, please? Honourable Member, why do you want to be recognized?
No, thanks, Chair. I'm rising on Rule 85.
Yes.
The honourable member is casting aspersion on Minister Manamela. He says he's got nefarious plans to dissolve NSFAS and put his hands on the millions that are there.
Honourable member, I heard the remark. You must withdraw that remark.
No, withdraw, but we're waiting.
No, honourable member, you must withdraw the remark unconditionally.
We withdraw unconditionally. We're waiting for Minister Manamela.
Please
About
proceed.
2 weeks ago, criminals burnt the University of Fort Hare and later tried to blame it on students. We're not surprised that the admin building was the first target because for many years, comrades of the ANC have been buying degrees at the University of Fort Hare. Tomorrow, when we investigate your qualifications which do not exist, you'll be telling us that the records burnt down during the student protest. I don't understand why this minister must wait for a calamity or disaster before he acts. The signs were there, both at the University of Fort Hare and at the University of Free State. Yet, he had to wait for buildings to burn before acting on governance issues and the very genuine concerns which were raised by students. Those are signs of a reactionary ministry, not a proactive ministry. Another silent epidemic, Chair, which is destroying South African families and now students, is gambling. NSFAS allowances meant for food and study materials are being swallowed by slot machines and online betting apps. This government has allowed the gambling syndicate to flood our phones, our screens, our sports, and even our airports, targeting the most vulnerable with flashy gambling adverts that make poverty look like bad luck, not bad economic policy. Over 63% of gamblers in South Africa gamble with money meant for essential needs like food, rent, and even school fees. We're going to explore a private member's bill to regulate and restrict gambling advertising. If we do not act now, then future generations will be swallowed by debt, addiction, and hopelessness. Minister of Trade and Industry, Park Style, instead of chasing tenders in the lotto, just do something good for once in your life and gazette stricter regulations for gambling advertising. Unless, of course, you are a beneficiary of the gambling syndicates like Bossa, Rise, the DA, and many of the other parties which are funded by the gambling tycoons. The EFF rejects this report. Thank you.
Thank you very much. IFP. Continue, honorable member.
Honourable Chairperson, I feel welcome this committee's thorough oversight reflected in this report and acknowledge the productive effort to enhance legislative processes and public involvement in the post-school education and training sector. However, the findings reveal that the national skills funding continued to record the qualified audit opinion from 2018-2019 to 2023-2024, primarily due to the inadequate assets management, procurement irregularities, and weak consequence management. The continued high vacancy rate compound these challenges, further impacting the operations efficiency and strategic implementation. The report initially misled the misleading of Parliament about the role of the independent panel in the sector appointment processes underscores the urgent need for the strengthening project management and enhancing government structures. The IFP calls for accelerated implementation of a real-time asset verification system and full transparent in the procurement processes, ensuring the strict adherence to regulations. Prioritizing the filling of the key vacancies is essential to restore the institution capacity and strengthening the governance. We further urge a culture shift within the department that prioritizes compliance, accountability, and transparent management and a non-negotiable standards. The IFP accepts the report, but stressed the necessity for time follow-ups on recommendations and progress tackling and periodic update to Parliament. Only through decisive and ethical action can public trust in our post-school education and training sector be restored and maximized for the benefit of all South Africans. I thank you, Chairperson.
Thank you. PA.
Honorable members, let's stop with the provocation, please. You are protected, honorable member, please continue.
Honorable Speaker, esteemed colleagues, South African patriots, Minister, you are greeted. As the Patriotic Alliance, we note with concern the irregularities and lack of transparency that have made this process. Leaked list of appointees, the refusal to disclose the identities of the independent panel members, and the involvement of department officials and political advisors in what was purported to be an independent process, raise serious questions about the integrity of the appointments. The Patriotic Alliance stands firm for accountability, meritocracy, and public trust. In our institutions, we cannot condone a process that appears to have been politically manipulated, lack proper vetting, and undermines the credibility of the Setas institution that are vital to skills development and economical empowerment in our country. We condemn the committee for its rigorous oversight and for holding the Minister of Higher Education, Dr. Nkabande, accountable. The committee insisted on full disclosure, proper documentation, and the appearance of panel members before the Parliament is a testament to the strength of our democratic institution. However, we remain deeply troubled by the following, Minister: the concealment of the panel members' identity under the guise of privacy, the mismatch between qualifications and sector relevance among some appointed chairpersons, the involvement of individuals with questionable characters and political affiliation, the ex-minister Nkabande misleading statement regarding the independence of the panel. The Patriotic Alliance called for a full parliamentary inquiry into the appointment process, the immediate suspension of any chairperson whose appointment are found to be irregular. And I thank you.
Thank you very much. FF Plus. Continue, honorable member.
Agbare huisvoorsitter, na die PA se poging om my stil te maak, gaan ek tog maar praat met die druk van 'n knoppie. Hierdie verslag van die Seta voorsitters en die Seta rade se aanstelling is seker een van dies wat die meeste van die parlementêre werk wat die meeste aandag in die algemene pers gekry het. Omdat dit die eerste keer is in 'n baie lang tyd waar die parlementêre oorsigproses werklik doeltreffend was daarin om die uitvoerende gesag verantwoordbaar te hou. En daar's 'n baie goeie rede hoekom dit gewerk het. Dit is omdat dit 'n komitee is waar daar nie een party is wat die meerderheid het nie en waar die lede van die komitee vasbeslote was om die minister verantwoordbaar te hou ongeag of hulle aan dieselfde party behoort het of nie. En dit was eintlik 'n voorbeeld wat voor die kameras afgespeel het van hoe parlementêre oorsig en verantwoordbaarheid behoort te werk. Wat gebeur het natuurlik die minister haar werk gekos en heeltemal tereg so. Maar daar is 'n kwessie wat nou nog nie bespreek is nie. Dit help nou nie as jy die 6de spreker is dat jy weer vertel wat staan in die verslag nie. Ek sou wel eers wat dit in Afrikaans doen, maar almal weet al wat dit in die verslag gestaan. Die punt is dat ons met 22 setas sit en geen mens weet waarvoor het ons 22 setas nodig nie. Die wet skryf nie 22 voor nie. Die wet sê doodgewoon daar moet sector education and training authorities wees. En daar kan in so 'n authority, in so 'n seta kan daar chambers wees verskillende bedrywe. Nou hoekom 22? Ek dink dit is om vir 22 rade werk te gee om vir mense wat jy nêrens anders kan aanwend 'n pos te kry waar hulle ook ietsie kan doen en 'n geldjie kan kry en ek gebruik spesifiek nie die woord geld verdien nie. Ek hoop dat hierdie hele storie wat nou afgespeel het daartoe sal lei dat die samestelling van die setas as geheel hersien word. Baie dankie.
Thank you. Action SA.
Thank you very much, House Chair.
Honourable House Chair, Setas are always on the agenda for the wrong reasons. As Action SA, we have consistently raised the alarm. These bodies are black holes consuming over 20 billion annually with no transparency, no measurable outcomes, and no public confidence. The actions of the now removed Minister of Higher Education in appointing a dodgy panel of friends just shows how deep the rot goes in these institutions. Setas are nothing more than a slush fund for connected comrades. The fact that the former minister, even after misleading Parliament, still holds a seat as an MP demonstrates how unserious the GNU is about accountability. Honourable House Chair, walk onto any street in South Africa and ask any citizen what exactly do Setas do. You will be met with absolutely silence. They are fundamentally broken, House Chair, and this House cannot fix that, and processes of selecting new chairpersons also cannot fix that. We must confront this reality. Band-aids will never fix the Setas. It is time to scrap them entirely and go back to the drawing board. As Action SA, we advocate for collapsing the Setas completely and redirecting their massive budget into our innovative opportunity fund. This will transform the lives of South Africans and not line the pockets of connected elites. As Action SA, we will continue to demand accountability, transparency, and performance. In the meantime, we must stop the bleeding of billions into these black holes and benefiting selected view. Thank you very much, House Chair.
Thank you very much. ACDP.
Honourable House Chairperson, the ACDP asserts that the Portfolio Committee's report on the appointment processes of chairpersons of the accounting authorities of the Setas clearly raises serious concerns about procedural integrity and governance standards. After the initial round of appointment processes, which was deemed procedurally flawed, the process governed by the Skills Development Act led to the reissue of the call for nominations. The ACDP has consistently called for ethical leadership, sectoral expertise, and transparent appointments in public entities. This is especially important here, given the billions of rands of public funds that Setas have to administer. Yet the committee's report confirms that several Setas have failed to meet the minimum criteria, undermining the credibility of the appointment process. The Department of Higher Education and Training's call for nominations required candidates to hold a postgraduate qualification and demonstrate sector-specific experience. However, civil society groups have criticized the lack of published shortlists and the absence of public interviews. Furthermore, Section 195 of the Constitution, which demands public administration be accountable and governed by high standards of professional ethics, has not been enforced. The opacity surrounding the appointments of Seta chairpersons risks politicization of skills development and weakens institutional independence. As kingdom builders working to fulfill our constitutional mandate, the ACDP insists on the full disclosure of appointment criteria, stakeholder input, and performance-linked accountability frameworks in the appointment processes at Setas and other government entities. I thank you.
Thank you very much, Honourable Member. UDM.
Honourable House Chair, the UDM supports this report with strong suggestions that the process of appointing new chairpersons of Setas should be sped up to ensure oversight over the Setas management and operations. Honourable members, it is quite disappointing that today we are debating the shortcomings and systemic flaws in the appointment processes for chairpersons of sector education and training authorities. This is more than disappointment, but a concerning affirmation that the cadre employees continue with nepotism and political influence in state institutions. Setas scandal merely revealed a persistent abuse of power to benefit comrades. And if we don't talk about it, our state institutions will become dysfunctional with poor management. This appointment process did not only undermine the strides and policies that have been put in place to ensure that due process is followed, but it shows us that the current system lacks accountability. Majority of South Africans might have lost interest to even partake in these processes because the picture has been painted that the process is not credible and positions are reserved for the politically connected. Therefore, legislative reforms should be implemented to restore confidence in Setas. We need policies that will guarantee that there is no political influence during the appointment processes, including proper vetting processes to ensure that panelists do not have conflict of interest. The UTM commends the people of South Africa for their scrutiny of the processes. Their voices played a vital role in enforcing accountability. I thank you.
Thank you very much, Honorable Member. Rise. Rise. Bosa.
Thank you, Chairperson. As Build One South Africa, we rise to welcome the good reforms that are being implemented to restore integrity and transparency in the appointment processes of the Setas. We want to commend the Portfolio Committee for its oversight and its swift corrective action to clean up the calamity that was left behind by the previous minister. And so we support the report. The report lays bare, though, a very disturbing picture, and member after member has been consistent in articulating this. There was political interference, procedural manipulation, and a total disregard for due process, and that had become the norm. The revelations that the former minister misled Parliament, appointed an illegitimate panel, and bypassed governance procedures in the appointment of Seta chairpersons represents not only a failure of leadership, but a betrayal of the oath of office. So we can't ignore this, that the GNU firing a minister is not accountability. It's an administrative act and it's not justice. True accountability means consequences that are proportionate to the harm that's been done, coupled with reforms that prevent it from happening again. So Parliament has to insist on clear performance targets, transparent evaluation systems, and regular public reporting to ensure that Setas deliver on their core mandate, which is actually equipping young South Africans with skills for work. Despite hundreds of high-level referrals flowing from the State Capture Commission, we are today here, mid-2025, only having 4 of 218 criminal investigation recommendations having resulted in convictions. So it's a dismal record which shows that we've had no accountability before. Even now with the GNU, we still do not have accountability. So we've got to ensure that never again does a minister escape consequence while people pay the price. I thank you.
Thank you. ATM. Al-Jama.
No declaration.
Thank you. NCC. PAC. UAT. Good. The ANC.
No, thank you very much, House Chair. It shows that we are indeed the epitome of transparency and accountability as the ANC. Hence, today we want to reaffirm our persistent commitment to a post-school education and training system that is transparent, accountable, and transformative. Sector Education and Training Authorities, or Setas, are central to this mission. They are the instruments through which South Africans gain the skills to access meaningful work, contribute to the economy, and participate fully in the development of our nation. House Chair, the integrity, competency, and ethical leadership of the School Education and Training Authority chairpersons remain non-negotiable. While delays in appointing accounting authorities have been regrettable, They were necessary to address the weaknesses in the system and ensure that the appointment process upholds the higher standards of governance. It was our collective responsibility, not any other party, but collective responsibility to act decisively, to restore oversight, to strengthen accountability, and ensure that the Setas fulfill their vital roles in advancing socio-economic transformation and equitable opportunity and inclusive growth. The committee's observation has brought important issues into light. One, the oversight has revealed that procedures were not followed as intended, and then the independence and transparency were compromised in several instances. And would wish to echo that it is through the administrative flaws that is led by the Director General. These challenges must not be viewed as an administrative missteps alone. However, they reflect broader governance shortcomings that must be corrected to safeguard public confidence in our institutions. As the ANC, we note and support the committee's recommendations. We urge the department to act swiftly and decisively to implement them. The recalibrated appointment process must restore the integrity of the Setas and reaffirm confidence in the leadership. Departmental officials must be empowered to carry out their duties without fear or interference, and proper systems of accountability must be reinforced to prevent future governance lapses. House Chair, furthermore, the recommendations around legislative clarity are critical. The roles and responsibilities of accounting offices in appointing seat accounting authorities must be clearly defined to avoid procedural ambiguity, misrepresentation, and conflict. When we strengthen this framework, we need to ensure that Setas operate with transparency and efficiency in servicing our national skills agenda. Honorable members, we as the ANC, we continue to remain committed by building a post-school education and training system that is people-centered and people-future-orientated. The Setas must not only meet compliance and standards, they must be driven by opportunity, transformation, innovation. And our primary focus must remain on ensuring that every young person, every worker, every community has access to the skills that will open doors to do a better life for all. In echoing the chairperson's words, Honorable Litsie, the African National Congress joins in calling upon the department and the new Minister of Higher Education, Dade Manamela, to continue to prioritize the full and timely implementation of the committee's recommendation. Doing so will not only strengthen governance and oversight, but also reaffirm public confidence in the state's capacity to deliver with integrity and the purpose. The mighty African National Congress stands ready to support these efforts and to ensure that the lesson learned from this process contribute stronger, more accountable, and more effective institutions in our post-school education and training.
Thank you very much, Honorable Member. I now recognize the Honorable Chief Whip.
Honorable House Chair, I move for the adoption of the report.
We can't hear you. I think I'll use my discretion. You can sit so that we are able to speak to the mic.
House Chair, I move for the adoption of the report.
Honorable members, the motion is that the report be adopted. Are there any objections? MK?
Thanks, Chair. We reject and call for a division.
A division having been called, the bells will be rung for 3 minutes. Honorable members, the Speaker has determined that in accordance with the rules, a manual voting procedure will be used in this division. Firstly, in order to establish the quorum, I would request the table to confirm that we have the requisite number of members physically present in the chamber and on the virtual platform to take this decision. Party whips will then be given an opportunity to confirm the numbers of their members present, indicate if they vote for or against the question. A member who wishes to abstain or vote against the party vote may do so by informing the chair. Honorable members, having confirmed that we have the requisite quorum, we will now proceed. The question before the House is a report of Portfolio Committee on Higher Education on appointment process of chairpersons of sector education and training authorities be agreed to. Voting will now commence. The doors of the chamber will be locked and members will not be allowed to enter the virtual platform until voting is concluded. Whips will then confirm the numbers of the members present in the chamber and on the virtual platform and indicate if they vote for or against the question. Party whips will record the numbers of votes of their members who are present, the ANC.
House Chair, we've got 108 on virtual and 31 physical for a total of 139 in support.
Did you get that? Please, can you repeat in the chamber, how many are you?
108.
No, you said virtual, you are 108, we got that.
31 physical.
31.
Yes.
Okay. The TA?
Thank you, House Chair. 19 members in the House, 57 online. It's a total of 76, and we vote in support.
MK?
Thanks, Chair. 30 online and 17 physical, total 47, and we vote against.
EFF?
Thank you, House Chair. 21 online, 10 in the House, 31 in total, voting against. Thank you.
IFP?
Voting in favor, online 7, in House 5. Thank you.
PA?
Patriotic Alliance, 4 in the House, 4 on the virtual platform, 8 in on Steam and Khans.
FF Plus?
Thank you, House Chair. We are 1 online, 2 in the House. That's 3 voting in favor.
Action SA?
Thank you, House Chair. Action SA 2 in the House, 1 on the online platform, 3 in favor.
ACTP?
Thank you, Chair. 2 in the House, 1 online in support.
UDM?
2 online in support.
RISE? BOSA?
1 in the House and 1 online in support.
ATM? Al-Jama?
Al-Jama, 1 in the House, in support.
NCC?
Thank you, Chair. 1 online, not in favor.
DAC? UAT? Good. Is there any member that wishes to abstain or vote differently to their party? The voting session is now closed. We'll give the results.
Honorable House Chair. Honorable House Chair.
Honorable Daniels.
Thank you for recognizing me, Honorable House Chair. I just want to set the record straight. I've just been informed that 2 of our members were kicked out virtually. They were locked in, but were kicked out when the session took place. So I want to place on record that we are now amending our total of 8 to 6. I apologize for any inconvenience caused, but we were not aware that the 2 were kicked out until they informed us now. Thank you, House Chair.
They were kicked out when they were in while voting.
Everybody was logged in. We confirmed.
We'll check. It's okay, Honorable Daniels. We'll check with IT, but we'll record the number that you've just said now.
Thank you very much.
Thank you.
Okay.
Honorable members, the results of the division are as follows. Abstentions 0, the noes 79, and the yes 247. The question is accordingly agreed to. I will now allow the secretary to read the third order.
Consideration of budgetary review and recommendation report of Portfolio Committee on Health on performance of National Department of Health and entities for 2024-25.
I now recognize the Honorable Chief Whip.
Thank you, House Chair. I move that the report be adopted.
Request for declarations of vote have been received in line with the motion which was agreed to by the House on 21 October 2025. I will now allow for up to 2 minutes, one member of each political party wishing to make a declaration an opportunity to do so. The DA.
Thank you, Chairperson. The annual report of the National Department of Health paints a deeply concerning picture. While progress has been made in some areas, the persistent weakness in governance, consequence management, and financial accountability remains a serious threat to the integrity of our health system. The National Health Laboratory Service, a critical pillar of our public health infrastructure, continues to face operational and financial challenges. Audit weaknesses, irregular expenditure, and inefficiencies have undermined service delivery, particularly in diagnostic testing, which is the backbone of disease surveillance and treatment. This is unacceptable in a country still battling with very high burdens of HIV, TB, and non-communicable diseases. Chairperson, the department's continued failure to enforce consequent management allows misconduct and negligence to go unpunished. Corruption and maladministration within the health sector diverts scarce sources away from patients who need them most. We must send a clear message. Fraud and corruption in health will not be tolerated. Accountability must not be optional. It must be enforced. Equally alarming is the shortage of health professionals, doctors, nurses, and specialists across the provinces. The slow pace of recruitment and weak retention strategies are deepening the crisis in service delivery, particularly in rural and undeveloped areas. Finally, the escalating medical legal claims threaten the financial stability of the health sector. Urgent reforms are needed to strengthen risk management, improve patient safety, and reduce negligence-related claims that drain billions from the health budget every year. Chairperson, our health system cannot heal if accountability is weak, corruption is tolerated, and our professionals are demoralized. The department must act decisively to restore trust, strengthen consequence management, and ensure that every rand is spent on quality healthcare to our people. I thank you.
Thank you, Honourable Member. MK.
Chairperson, this report before us today does not show progress. It shows that our public health system is struggling and the Department of Health is falling in board management and accountability. The department says it spent 99.5% of its budget, yet it did not meet over a third of its service delivered target. It shows that the money is being spent, but the results are not being achieved. Budgets are used up, but the clinic still lacks staff, hospital lack equipment, and the patient wait too long for care. The focus is on spending money, not for improving services that save lives. The National Health Laboratory Services receive a disclaimer of opinion from the Auditor General. Means its records could not be trusted. It could not be verify its assets, debt or inventory, and only achieve 36% of its target. This shows the serious management failure when the laboratories cannot manage its own system. It loses the ability to support the country's health system properly. There was over 306 million in irregular expenditure, violating the Public Finance Management Act. No proper action has been taken, showing that there is no accountability for financial misconduct. Section 27 of the Constitution gives every South African right to health care. When the money is misused and services fail, people's health and lives are affected. Each case of irregular spending represents a mistreatment and poor service delivery. The problem at NHLS affects disease monitoring, pandemic response, and health research. Without accurate data, it's become difficult to manage disease such as HIV and TB or respond to a new threat. The department responsibility it's for.
Honourable Member, your time is expired.
Okay, let me wrap up.
No, don't wrap up. Your time is expired.
Thank you, Chairperson. EFF, MK rejects this budget.
Bonga Slalo, EFF notes the Health Committee's BRRR. We call on the Minister and the Department to start working in good faith from now onwards. We share the sentiment with AG that we are very suspicious of the reports that they submit. Things always look good on paper, but the reality is that it is not the case on the ground. For example, there's an MP who went to a clinic for 3 weeks, but the minister comes here and says it takes 2 hours to detect TB. It is further concerned that of the hospitals that were monitored, only 7 are noted as being ideal hospitals. This essentially means that our consistency in calling out the department for the ailing and crippled public health care system was not just an opinion, it was in actual fact, a fact. NHLS continues to regress and fails to implement AG recommendations. Ombudsman and CMS are still understaffed and under-resourced. Our public purse is still being looted with criminals not facing jail time. Much more must be done for accountability in this regard. We raise a grave concern on the targets the department makes for itself. For instance, that the NHI benchmark is still located in delivery of medicines is a concern. Although the minister claims the department reaches its NHI milestones, we argue that the current setup isn't sufficient to usher in the NHI expeditiously, which is now law. They must build state capacity. Tembisa Hospital heist could have been avoided if the EFF's recommendations for building state capacity were taken up by the department. It is not the case because the truth is that the ANC and DA comrades fund their lavish lifestyles with the monies meant to keep our people alive. This is why these two parties fight tooth and nail to protect a tender system that has proven to cripple our public health care and seize the lives of vulnerable people and whistleblowers, ending prematurely. We reject this report on the basis that it commends the department on its performance in this year. We have nothing to celebrate. We will never affirm this criminal syndicate department until its total overhaul, restructuring, and ensuring that public health care and justice occurs in our lifetime.
Honorable member, your time is expired. IFP.
Honorable House Chair, in our manifesto, the IFP rightly identified the numerous challenges that have undermined the South African public health system's ability to deliver the adequate services to its citizens. The Tembisa Hospital scandal stands as a reminder of the deep-rooted corruption that continues to plague our public health system. Honorable House Chair, it is important to reiterate the IFP's position in terms of the NHI. The IFP supports the universal health access, but rejects the NHI in its current form. The IFP welcomes the clean audits achieved by the Medical Research Council, Office of the Health Standard Compliance, and South African Health Products Regulatory Authority, which reflects successful implementation of robust internal controls. Furthermore, we commend the fact that no fruitless or wasteful expenditure was incurred. This stands as a powerful reminder that clean governance is not a myth or an abstract ideal. It is both achievable and essential. The IFP therefore urges the department to prioritize engagement with the National Treasury to secure additional funding to properly capacitate our hospitals and clinics. In consideration of the issues we have raised, the IFP accept the report. I thank you.
Thank you, Honorable Member. Patriotic Alliance.
House Chair, the Patriotic Alliance has expressed our support for this report. Minister, the budgetary review and recommendations report is indeed comprehensive, well compiled and detailed. It also incorporates valuable analysis from the Financial and Fiscal Commission, as well as the Auditor General of South Africa on the health sector's annual performance. Primary health care, the foundation of our system, continues to receive less than 40% of the total budget, leaving rural and underserved communities at a disadvantage. Community-based programs deliver higher value for money compared to hospital-based care. However, despite the reports and analysis looking impressive on paper, it's a far cry from the reality on the ground. We must confront reality reflected in incidents such as the Tembisa Hospital scandal. The Tembisa Hospital case is not an isolated incident. It raises serious concerns about how many other hospitals may be facing similar issues where public funds are being misused or treated as personal piggy banks. We therefore recommend 3 key actions. First, increase funding for primary and preventative care to strengthen our health system. resilience. Second, enhance efficiency and transparency through performance-based budgeting. And thirdly, build capacity at district and facility levels to ensure timely and effective use of funds, and that every rand allocated to healthcare truly benefits the people it is meant to serve. Thank you.
Thank you, Honorable Member. Freedom Fund Plus.
House Chairperson, the Tembisa report issued by the Special Investigation Unit shows that an amount of 2 billion was looted through officials and cartels at that very same hospital. These looters are now focusing their attention onto the Northwest Department of Health to continue their looting there, and they have approached the High Court in Mahikeng in order to be rewarded a tender of 1 billion rand to supply food to the hospitals in Northwest. This also shows us that not everything is well at all provincial departments across the country, and therefore the VF Plus calls for an intensive audit to be done at all provincial and state hospitals in order to determine if there is also corruption taking place, at what scale, and to determine if a national department and the 9 provincial departments have put precautionary measures in place to combat corruption, mismanagement and maladministration at all of these institutions. On the National Health Laboratory Services, the Auditor General reports a regular expenditure of 306.8 million that was not included in the consolidated and separate financial statements of this entity. There is also a concern regarding an increase in provincial debt from 7.8 billion rand in 2023-24 to 9.2 billion in 24-25. Complaints submitted to the Health Ombudsman have increased, but they still have not received the adequate funding from Treasury to utilize or strengthen their operational capacity. 10 million was received from Treasury after they requested a 30 million rand increase in funding. Funding is also a huge concern at the Office of Health Standard Compliance, with only 42 inspectors in the service and 35 currently undergoing training to be certified. There is no way that even with a system like self-assessment and smart inspections of hospitals and other health facilities across the country, this office will be able to complete their work, therefore successfully. SAPRA's enforcement capacity need to be strengthened regarding the distribution of fake or unregulated medicine. Let's stop the looting at our health departments and facilities. I thank you, House Chairperson.
Thank you. Action SA.
Chairperson, Action SA notes the improvement in the Department of Health's performance from 58% to 62%, with primary healthcare performing best. This shows some effort to stabilize delivery, but it falls far short of the standards South Africans deserve. Despite this marginal improvement, the department again failed to prepare financial statements in full compliance with reporting standards, a repeat failure that exposes weak leadership and oversight. Across the sector, consequence management is virtually non-existent, with irregular expenditure and poor accountability continuing unchecked. The Tembisa Hospital scandal remains a symbol of the rot in our public health system. Action SA supports a call for a sector-wide audit to uncover corruption and ensure those responsible face consequences. On the national health insurance, we remain deeply concerned. Engagements continue, but there's little progress in establishing the NHR fund or contracting units, while a 200 billion funding gap threatens to make this plan financially unsustainable and politically opportunist rather than practical. We've seen what happened at the Road Accident Fund. We commend progress in the HIV and TB programs, but note worrying signs, declining TB detections and rising new infections among young women. These demand decisive actions, not rhetoric. Persistent infrastructure failures from Charlotte Mngeki Hospital to delayed projects nationwide reflect years of neglect and poor contractor oversight. Action SA calls for stronger governance, transparency, and quarterly accountability reports from all entities. South Africans deserve a health system that works, not one crippled by mismanagement and corruption. I thank you.
Thank you, Honorable Member. ACTP.
As Chairperson, South Africa's public health system continues to face systemic inefficiencies. Parliament must demand ethical stewardship, measurable outcomes, and urgent reform on provincial health governance. Chairperson, The Portfolio Committee's budgetary review and recommendation report on the performance of the National Department of Health and its entities for 2024-25 reveals troubling patterns. Despite a budget allocation of 64.5 billion rands, the department underspent by 3.2 billion rands, while irregular expenditure rose to 1.1 billion rands, a regression from the previous year's audit outcomes. The Auditor General attributes this to poor contract management, persistent vacancies in key posts, and excessive reliance on consultants. The ACDP has consistently called for ethical governance, performance-linked funding, and transparent oversight. Yet, Parliament has failed to enforce accountability mechanisms under Section 195 of the Constitution, which requires public administration to be accountable, development-orientated, and governed by high standards of professional ethics. The committee's report also notes that the Office of Health Standards Compliance remains under-resourced, compromising its mandate to enforce quality norms across facilities. Meanwhile, the National Health Laboratory Service, facing huge backlogs in TB and cervical cancer diagnostics, which forces them to delay treatment and jeopardize patients' health, has turned to the private sector to help clear the backlog. Social media commentary has criticized Parliament's silence on whistleblower protections and its failure to act on corruption allegations in provincial health tenders. Thank you.
Thank you, Honorable Member. UDM. Rise.
No declaration, Chair.
Thank you. Bosa.
No declaration from Bosa.
Thank you. AGM. Al-Jama.
Honorable Speaker, on the declaration on consideration of the BRRR of the Portfolio Committee on Health, Al-Jama supports the report of the Portfolio Committee on Health. We note with concern that the department's failure to meet employment targets, particularly in appointing doctors and other healthcare professionals amid severe shortages. While we welcome the Finance Minister's approved budget for the recruitment of healthcare staff, many qualified South African doctors and nurses remain unemployed. This must be urgently addressed to prevent further strain on our health system. Al-Jama further calls for preference in filling vacancies to be given to South African healthcare professionals, especially women, youth, and persons with disabilities. Malibongwe.
Thank you, Honorable Member. NCC.
Thank you, Chairperson.
PAC.
Chairperson, parties need to stop.
Okay, continue, Honorable Member.
Thank you. Parties need to stop speaking against the reports that's being delivered and then vote in favor of it. Thank you.
PAC. UAT. Good. The ANC.
Thank you, House Chairperson. The African National Congress supports the Portfolio Committee on Health's budget review and recommendations report as an expression of our commitment towards the realization of universal health coverage. We are encouraged by the continued support, positive support, performance of entities such as SAPRA, which successfully maintains the International Organization for Standardization 9001 certification by the SAPS and SAMRIC, which has surpassed research output targets and awarded more than 600 research scholarships. We also welcome the OHSCS continued commitment to improving patient experience and health outcomes in the
health sector. Through the committee's critical recommendations on consequence management investment on CHWs, ILD clinics and hospitals, expanding TB screening and multi-month ARV dispensing, and accelerating the implementation of NHI, we remain confident that the sector will expand access and build a more agile and responsive healthcare. Health is a cornerstone of society. It must be our collective desire to support the ministry in the interest of public health and also in ensuring that our health system leaves no one behind.
Thank you very much, Honorable Member. I put the motion again. Are there any objections? No objections. The report is agreed to. Yeah, I see. Honorable members, you must stop looking at your phones.
I have a new chief whip here.
The new chief. And here I say the new chief whip. Chief whip of the MK.
We object to the report. Thank you.
Thank you. With that objection, the EFF?
The EFF is objecting. Please note our objection. Thank
With
you.
those objections, the report is agreed to. The secretary will read the 4th to 6th orders together.
Consideration of budgetary review and recommendation report of Portfolio Committee on Public Service and Administration on Vote 7, National School of Government Annual Report 24-25 financial year. Consideration of budgetary review and recommendation report of Portfolio Committee on Public Service and Administration on Vote 11, Department of Public Service and Administration, Government Employee Medical Scheme, and Center for Public Service Innovation. And consideration of budgetary review and recommendation report of Portfolio Committee on Public Service and Administration on Vote 12, Public Service Commission.
Thank you. I now recognize the Honorable Chief Whip. Yeah, he's busy talking to members.
Thank you. Sorry, I'll say my apology. I move that the report be adopted.
Thank you. The request for declaration of votes have been received. I will allow for up to 2 minutes, one member of each political party wishing to make a declaration an opportunity to do so on all the budgetary review and recommendation reports that the House will consider. The DA.
Thank you, Honourable Speaker. The Democratic Alliance welcomes the committee's consideration of the 2024-25 budgetary review and recommendation reports for the Department of Public Service and Administration, the National School of Government, and the Public Service Commission. While the DA commends both the DPSA and the PSC for maintaining clean audits and high performance rates, 100% and 96% respectively, the deeper reality is that our public service continues to suffer from inefficiency, politicization, and a collapse of accountability. The Public Service Commission in particular stands out as a model of institutional discipline and constitutional integrity. It has delivered consistent clean audits, upheld transparency, and fulfilled almost all of its performance targets. Yet Treasury continues to cut its budget while channeling more funding to departments that routinely ignore its recommendations. In doing so, government effectively cuts off the PSC's hands, forcing it to rely on desktop assessments instead of physical verification and weakening one of the few oversight bodies that still functions without fear or favour. The National School of Government, meanwhile, has faced an uncharacteristic but deeply concerning lapse. A qualified audit on its trading account in the first in years reveals weaknesses in internal controls and financial reporting. While this may be an isolated occurrence, it is particularly troubling in an institution tasked with embedding ethics, accountability, and professionalism across the public sector. The NSG must urgently restore its credibility because it cannot train others to uphold standards it does not consistently meet itself. Honourable Speaker, the DA will continue to champion a public service built on merit, integrity, and performance, not political loyalty. South Africa deserves a state that rewards excellence, enforces accountability, and restores pride in public administration. I thank you.
Thank you, Honourable Member. The MK.
Honorable Speaker, the Mkondo Party rises today with a clear message. South Africa deserves a government that's work, not one that merely attend workshop. National School of Government was created to build a capable, ethical and professional public service, the kind that our people have been promised since 1994. Its mandate is crucial, but Honorable Speaker, a mandate without measuring results is just a slogan. And what do we see? Conferences, certificate, training headcounters. Honorable Speaker, Cabinet adopt the professionalization framework back in 2022. Yet 2 years later, the rollout is crawling at the pace of a broken printer. Department remain staffed with unqualified cadres who treat public service like personal employment and the public like an inconvenience. It seems we are measuring attendance, not impact. The NSG promised professionalism program for middle managers, but are nowhere near being installation across department. The report is silent on whether this initiative have actually changed a single citizen experience at a clinic, a school, a police station, or a home affairs. We still have long queues, rude and uncountable officials, phone ringing unanswered, complaint ignorance, corruption treated as HR. South Africa are tired. They are tired of allied states working for connection fees while masses stand in queue for down and dust. Vote 7 must be delivered, transformation not apparent to attendance certificate. Until we see proof that NSG is improving service delivery, the MK Party cannot fully support this vote. Thank you.
Thank you, Honorable Member. The EFF.
Honorable House Chair, the EFF has analyzed the 3 budgetary review and recommendation reports before this House today. And our overall view is one of deep disappointment. While these reports carefully describe the challenges facing a weakened public administration, they fail to offer a bold and transformative solutions needed for recovery. Instead, they reflect a managed decline, documenting slow deterioration rather than inspiring change, and systematic and deliberate collapse of state capacity. Chair, the South African public service is not being reformed. It is collapsing. It has become a carcass picked apart by an exploitative elite, opportunistic entrepreneurs, and their political facilitators within the so-called GNU. The vision of a professional and developmental state in the National Development Plan has turned into a fairy tale meant to pacify the public while corruption flourishes. Take the National School of Government, for instance. The report notes a shift from a clean audit to a qualified one due to a disastrous failure of the MyNSG platform learning system. This is not a minor error. It is a failed tender, likely awarded to an unqualified insider. The Public Service and Administration Department has also abandoned key targets due to budget cuts, effectively surrendering the dream of a capable state under the suffocating austerity imposed by National Treasury. We see no accountability for the 294 senior managers who failed to disclose their business interest. The government employees' medical system spends millions on board fees while public servants struggle to afford contributions. The Public Service Commission, despite clean audits, remains powerless. Its recommendations ignored by the executive. House Chairperson, these reports do not represent progress. They represent a decay. The EFF rejects them outright and call for a radical overhaul of the public service, not yet another empty report.
Your time is expired. Thank you. IFP.
Thank you very much, House Chair.
Our public service stands at a critical point where efficiency, ethics, and accountability must meet to restore public confidence in the state's capacity to deliver to its people. The committee's budgetary review and recommendations reports revealed both encouraging progress and persistent weaknesses that must be urgently addressed if we are to realize the vision of a professional, people-centered administration. The report highlights advances in governance, digital transformation, and professionalization, while also exposing ongoing challenges in financial management, audit outcomes, and system integration. The National School of Government continues to play an important role in empowering public servants through digital and executive educational programs, despite fiscal constraints and deficits in the trading account. The IFP agrees with the committee that there is a need for stronger internal controls, faster implementation of professionalization framework, and sustained investment in e-learning platforms to enhance capacity across all spheres of government. We commend the departments for their achievements, but urge continued focus on accountability, efficiency, and inclusivity in advancing Batubili principles. In consideration of these findings and recommendations, the IFP supports the BRRR reports. Thank you, House Chair.
Thank you very much. Member, the PA.
Honourable Speaker, esteemed colleagues, patriots. The Patriotic Alliance has studied the budgetary review and recommendation reports of the Portfolio Committee on Public Service and Administration, and we say it's time for real accountability in our public service sector. We appreciate the committee's work in assessing the National School of Governance, the DPSA, GEMS, the CPSI, and the PSC. These institutions carry the heartbeat of professionalism, honest and self-driven government. But, Honourable Speaker, our public deserves better. The National School of Government must move faster in training new generation of public servants who can serve in a modern, digital South Africa. Let's work with our universities and private experts to make this happen. The DPSA has made progress, yes, but the pace of reform is too slow and cadre deployment still holds us back. We need appointments based on skill, not political connection. Let's put competent people to lead, not comradeship. And the Public Service Commission, the moral complex of our government must be empowered to act fearlessly against corruption and malmanagement. Honourable Speaker, the Patriotic Alliance support the committee's work, but we call for bold action, real change, and a renewed spirit of service. Our people deserve a government that works for them, a public service built on pride, professionalism, and passion. Salute, ons Baizani.
Thank you, Honourable Member. FF+.
House Chair, the effective functioning of the South African public service is non-negotiable for building a capable, ethical and developmental state. But the South African public service has been marked by poor performance, skill shortages and service delivery challenges resulting in public dissatisfaction. We all know that a professionalized service eliminates wastage, derives value for money and is essential for aligning the state with the imperatives of economic growth and job creation. Sadly, this was not the case over the past 30 years. Corruption, a word that has sadly become synonymous to the South African public service, impedes service delivery and undermines public confidence. The fight must be intensified. especially against the scourge of ghost worker fraud. The Public Service Commission, which must champion anti-corruption efforts through oversight and initiatives like the National Anti-Corruption Hotline, must be better capacitated. The PSC must be able to enforce its mandate to its fullest extent. The Department of Public Service and Administration, which, according to reports, is strengthening accountability by developing a central register for disciplinary processes to track offenders and to monitor adherence to the prohibition on officials doing business with the state, is showing signs of improvement. This is welcomed. However, the lack of consequence management remains a persistent problem. Lifestyle audits are not being addressed comprehensively or urgently enough. Continuous mandatory audits for high-risk categories like supply chain management must be the norm in all departments. The National School of Government plays a vital role in professionalization of the public service. Though one cannot teach work ethic or honesty, the professionalization framework is a step in the right direction and must be fully and continuously implemented as a matter of urgency. Die Suid-Afrikaanse staatsdiens is oor die verloop van 30 jaar uitgekalwe deur swak bestuur, 'n gebrek aan politieke wil en misdadigheid in die ergste graad, maar daar is ligpunte wat deurbreek. Hoewel min, mag dit vermenigvuldig tot die punt van herstel. Ek dankie.
Thank you, Honorable Member. Action SA.
Thank you, House Chair. House Chair, Action SA believes that building a capable, ethical, and developmental state begins with professionalizing its public service. South Africans deserve a government that is staffed by competent, ethical professionals, not by political insiders or connected cadres. The Department of Public Service and Administration, the National School of Government, and the Public Service Commission each play a crucial role in this project. Yet, the committee's reports make it clear that progress remains uneven, with ongoing concerns about ensuring that all appointments across the public sector are transparent and strictly merit-based. We welcome the recommendations for tighter monitoring of recruitment, stronger lifestyle audits, and the development of a centralized digital platform that records all public service appointments in real time. These are practical steps towards transparency and accountability. But ethical governance cannot be achieved while irregular appointments like those that we've seen in the Department of Social Development and the Setas go unpunished. Such practices destroy morale, weaken service delivery, and send a message that accountability and rules are optional. Action SA rejects this notion. We urge that the Public Service Commission be properly funded to extend its mandate and oversight to local government, where dysfunction and interference still destroy communities and deny our people of basic services. Professionalizing the public service must start at the coalface of service delivery, and that is our municipalities. Honorable House Chair, professionalizing the public sector is not just a technical task, it is a moral one. To rebuild trust in government, we must put competence before connections and service before self-interest. Only then will South Africans again take pride in a public service that best works for them. Thank you, House Chair.
Thank you very much. ACDP.
House Chair, the ACDP understands the necessity to build an efficient, capable and ethical state that is free of corruption and committed to improving citizens' lives. And whilst there are hundreds of thousands of loyal, honest and hardworking public servants, there are still regrettably many who engage in corrupt activities. The Zondo Commission identified the primary mechanism of state capture to be the strategic positioning of particular individuals in position of power, which were then used to gain control of public procurement and over law enforcement agencies. Corrupt politicians and officials used appointments and disciplinary processes to remove law-abiding public servants and replace them with those who were willing to be complicit in corruption. The ACDP believes that what is needed is public servants who are true servants of the people and who understand the principle of stewardship of state resources, which are not there to be looted and stolen. We agree that one of the ways of combating corruption is by continuous lifestyle audits, particularly for those officials in high-risk categories, such as supply chain management, finance, and revenue collection. Lastly, the ACDP questions whether public servants are even aware of the provisions of the Corruption Act, PRICA, which not only criminalize corrupt activities, but also makes it a crime not to report such crimes where more than 100,000 rand is involved. We are not aware of a single prosecution in terms of Section 34. Perhaps public servants are prepared to turn a blind eye, given the inadequate protection of whistleblowers. There is, in our view, an urgent need to significantly enhance whistleblower protection and even to offer financial incentives, given the risks faced. The ACDP will support these reports. I thank you.
Thank you, Honourable Member. UDM. UDM. Rise.
I'll give my 2 minutes to.
Honourable Member, you can't do that. Bossa. We are not giving anything.
Thank you, Chair, and thank you to Rise. Build One South Africa notes and supports vote 7 for the National School of Government, as well as vote 11 for the Department of Public Service and Administration. But we want to turn our focus to vote 12 for the Public Service Commission. And we have got to confront a crisis that strikes at the moral core of our democracy. We have too many officials that are found guilty of misconduct simply reappearing in another department, while others linger as ghost workers that are draining billions from the public purse. In Gauteng alone, over 300 million has been lost to ghost employees, and in Johannesburg, corruption and mismanagement have crippled service delivery, as those who live there will know. With the city losing over 3.4 billion through water losses, unpaid supply and poor billing. These failures, especially in local government, are not abstract, because local government is where citizens meet and confront with governance. These failures rob clinics of medicine, they rob schools of resources, and quite frankly, they rob communities of hope. And so ahead of the local elections, we really have to be honest that this is not just a governance failure. It is a moral one, and it's written on the faces of citizens who are being robbed of what is due to them, the services that are due to them every single day. Across the public service, billions are lost each year to ghost employees, while honest officials who are trying to do their work remain demoralized. And so as Build One South Africa, we call on the executive to work with the Public Service Commission to end the recycling of disgraced officials. There should be lifetime bans, audits, and elimination of ghost workers, and the stabilization of leadership by ending the over-reliance on acting and contract appointments. South Africans do deserve a state that works and one that rewards integrity, not impunity. Thank you.
Thank you. ATM. Al-Jama.
Honorable Speaker, as Al-Jama, the trusted party, we support this report. Al-Jama commends the National School of Government, NSG, for its continued efforts to build a capable, ethical, and professional public service. Also noted is the need for greater impact in implementing training programs that translate into improved service delivery, especially at local government level where citizens experience the state most directly. Al-Jama calls for the NSG to strengthen partnerships with academic institutions and expand training access to young graduates, women, and persons with disabilities, ensuring that transformation and excellence go hand in hand. We also urge continuous monitoring to ensure that public servants apply the training received in their daily work for the benefit of all South Africans. I thank you.
Thank you, Honorable Member. NCC, PAC, UAT, good. Honorable Members, Honorable Baba Jaba is not feeling well, so she requested that can she do the declaration while in her seat, the ANC.
Thank you very much, Honorable Chairperson. Honorable Chairperson, the ANC wishes to declare its support for the budget review and the recommendation for the Department of Public Service and Administration, the Government Employee Medical Scheme, the National Schools of Government, the Center for Public Innovation, and the Public Service Commission. The ANC believes that to combat poverty and inequality, the state must take a transformative and developmental approach. This requires well-running institutions and qualified public servants to ensure effective coordination, providing high-quality services while prioritizing national developmental goals. This fosters trust in the state and strengthen its efficacy, benefiting individuals from all backgrounds. This vision necessitates a capable and developmental state to formulate and implement policies that serves the national interest. These policies should address the root causes of poverty and inequality, and strengthen the state's capacity to fulfill this role. Honorable Chair, the DPSA is at the strategic center to enforce and monitor the implementation of the ideals of an ethically capable and developmental state. Honorable Chair, this BRR report is at a step towards the Vision 2030.
Honorable Member, your time has expired.
That government envisage, the ANC support the recommendation.
Siyabonga, Mama. I put the motion again. Are there any objections? The Chief of the MK.
Thank you, House Chair. Kindly note our objection. Thank you.
Thank you very much. There's energy now. EFF.
Thank you, House Chair. Note the objection of the EFF.
With those two objections noted, the report is agreed to. The Secretary will read the last order of the day.
Consideration of budgetary review and recommendation report of Portfolio Committee on International Relations and Cooperation.
I now recognize the Honorable Chief Whip.
House Chair, I move that the report be adopted.
Declaration or request for declaration of votes have been received. I will now allow for up to 2 minutes, one member of each political party wishing to make a declaration and opportunity to do so. The DA.
Thank you, Honourable Chairperson. While the DA supports the 2024-25 Budgetary Review and Recommendations report for the Department of International Relations and Cooperation, it heralds a marked departure from a culture of financial transparency and accountability to one of financial recklessness and rank misprioritization under Minister Ronald Lamola. For the first time in many years, this department's audit outcome has regressed from unqualified to qualified with material findings. The Auditor General has cited, among others, significant deficiencies in the department's asset management process, where lack of maintenance has rendered our embassy buildings uninhabitable. The face of South Africa abroad is further tarnished by this financial mismanagement. The department's asset register and asset verification processes have not been carried out on a biannual basis as required, meaning DIRCO is losing its grip on our foreign properties. This is corroborated by reports of the South African embassy buildings in The Hague and London with broken windows and heating systems, no water or electricity, and lost or allegedly stolen artworks and artifacts. Furthermore, DIRCO's growing financial liabilities and misaligned priorities have robbed South African taxpayers of desperately needed services, such as those for crime intelligence and investigative powers, which have been cut. In addition, the department has yet to provide a detailed breakdown of all beneficiaries of humanitarian aid from the African Renaissance Fund, which is nothing more than the ANC's political slush fund used to prop up and sustain its party political alliances through the South African state. Honourable Chairperson, this BRRR is proof that DIRCO's finances have clearly been pooled into funding the ANC's party political diplomacy instead of capacitating a professional and credible South African Foreign Service, and Minister Ronald Lamola is the chief architect of our subsequent foreign policy decline and this department's severe financial regression. I thank you.
Thank you. MK.
Chairperson, honorable members, the Umkhonto weSizwe Party rejects the adoption of this budget review and recommendation report on the Department of International Relations and Cooperation, as it doesn't go far enough to bring the change needed and is an austerity budget, leaving vacancies in field, embassies falling apart, and services and economic diplomacy unfunded. DIRCO 99% expenditure is presented as success, yet behind the figures lies failure. A qualified audit, 983 million is unverified assets and 25% vacancy rate that has hollowed out the department. Infrastructure is collapsing. ICT modernization has ballooned from 814 million to 1.19 billion, and the OR Tambo PPP drains 329 million yearly. This is not a performance, it is paralysis. DIRCO measures what it does, not what it achieves. Where are the outcomes that improve the lives of our people? How many black, colored, Indian, and Khoisan entrepreneurs have joined trade missions? How much foreign investment has flown into townships and rural areas? Diplomacy without transformation is public relations for privilege. The MK Party therefore calls a Transformation and Impact Directorate to track inclusive participation, youth and SMEs quotas in all delegations, regular reporting on FDI inflows, and cultural diplomacy that includes Khoisan people. Chairperson, we also reaffirm our support for Palestine and call for a real two-state solution and accountability for genocide before the ICJ. We condemn NATO's reckless militarism in Ukraine and possible deployment of Tomahawk missiles, provocation to World War III, and call for non-alignment, peace and diplomacy across all global conflicts, and condemn any possibility on renewed attacks on Iran, preemptive unilateral strikes on Venezuela. South Africa's foreign policy must serve the poor, not the elite. We cannot keep up.
Honorable member, your time is expired.
Therefore, we reject this BRRR.
EFF.
Thank you, House Chairperson. The EFF notes the BRRR report. We are of the view that DIRCO should not, in 2025-2026 financial year, be allowed to regress and get a qualified audit opinion again with recurring findings. There should be internal audit controls to ensure compliance and accountability of how the budget is spent. The department is still battling with irregular expenditure of 2.2 billion, and audit action plans are not implemented, and there is no consequence management. The 24.6 vacancy rate at DIRCO is a cause for concern, especially because the allocation for compensation of employees is overspent by 12.6 million due to the depreciation of the rand against major currencies. This is going to be persistent even in the next financial year, because during budget vote 6, our recommendations to increase the allocation fell into deaf ears. In a world of evolving and rapidly changing ICT infrastructure, DIRCO still uses outdated ICT infrastructure abroad that compromises the ability to capture and manage data. This calls for immediate intervention. The country's foreign policy should be clearly communicated and not leave a room for doubt, just like the President has failed to implement the resolution of the 6th Parliament to cut diplomatic ties with genocidal state of Israel, while government has taken Israel to the ICJ. DIRCO should be given mandates to appoint trade attachés in our embassies to leverage our power and influence on trade globally. The failure to have significantly increased the budget of DECO should be worrisome to all of us. We have embassies and missions that are affected by budgetary constraints and will not be able to do their role of selling South Africa as a strategic country for trade or tourism. Our ambassadors are left frustrated with a budget that hardly covers their functions and staff vacancies that cannot be filled. We continue to spend money on leasing instead of buying properties for our missions abroad, which makes the cost of keeping and running those missions very expensive. Lastly, the government should decide on the direction that they want to take when it comes to the US. To not have filled the position of ambassador since the former ambassador Ibrahim Rasool was expelled is a sign of giving into the bullying by the orange man in the White House. Yet South Africa's paper tiger said we will not be bullied, and he's still bullied and is afraid of appointing an ambassador of South Africa into the US. The EFF rejects this report with the content.
Thank you. IFP.
Thank you, Honorable House Chair. The IFP supports this report as I'm still going to raise the following matters. The IFP acknowledges and commends the department's alignment on its priorities with national strategic goals. Our foreign policy must always serve the people of South Africa. As we strengthen our diplomatic presence across the world, we must ensure that our engagements translate into tangible economic benefits, investments that create jobs, open more markets for South African goods, and support local enterprises. Projections by global research shows that African countries would experience stronger exports growth if we were align our foreign policy with domestic trade strategies. This reinforces the importance of linking diplomacy to development outcomes. The department's commitment to economic diplomacy and regional integration should therefore remain a central pillar of its work. We further encourage the department to deepen collaboration with local industries and provincial government so that opportunities arising from international partnership directly benefit communities at home. Our foreign policies must not only project our values abroad, but also deliver prosperity to our citizens. In light of the matters I've raised, the IFP definitely support the report. Thank you.
Thank you, Honorable Member. PA.
Honorable Speaker, honorable members of the House, yes, it's Paisani. This report is more than a fiscal review. It is a mirror held up to our international posture. It compels us to ask, are our global engagement aligned with the lived realities of our people? Are we leveraging diplomacy to deliver tangible outcomes for our communities in Atlantis, Uppington, Mlazi, not just in Pretoria? We commend the committee's oversight of the Department of International Relations and Cooperation, DRICO, and the African Renaissance and International Cooperation Fund, ARF. The finding reveals both strategic intent and operational gaps, irregular expenditure, underspending and weak performance indicators erode public trust and diminish our influence abroad. These are not technical oversight. They are systematic failures that must be addressed with urgency. The Patriotic Alliance calls for a decisive shift in DRICO's priorities. Our foreign policy must be pro-poor and Afrocentric, rooted in the aspirations of ordinary South Africans. Trade enabling, with targets supported for township and rural entrepreneurs. Culturally grounded, amplifying our artists, healers, and heritage in global forums. Diaspora conscious, building bridges with South Africans abroad and African communities worldwide. We support the committee's recommendation for enhanced financial control, performance-linked budgeting, and strengthened parliamentarian scrutiny. But we go further. We demand that every rand spent on diplomacy be traceable to a local dividend, be it a scholarship, a corporate investment, or a cultural exchange. We also want to welcome the efforts made by Israel for a ceasefire. Also say thank you. We support.
Honorable Member, okay. FF plus.
No declaration, House Chair. We support the
A
report.
point of order, House Chair.
Thank you
On
very
a point
much.
of order, House Chair.
What's the point of order, Honorable Dlangwini?
House Chair, can that member be called back to withdraw that misleading statement he just made? Because that is misleading. And we can't continue to let South Africans believe that it's Israel that is wanting a peace mission while it's Palestine that needs to be freed. It was Israel that have been bombing young children and women and hospitals and keeping kids out of school and having basic services. It was Israel doing that, not Palestine. So he must come back and withdraw that misleading statement he just made. It is a sin to let him pass and not withdraw.
Thank you very much, Honorable Member, but that's not a point of order. And I am not going to request the member to come back. If you wanted to raise a point of order, we would have risen it at that time. And it is a point of debate, not a point of order.
House Chair, my hand was
continue and call the member action essay.
House Chair, my hand was up. You just didn't see my hand at the time that he raised that, but my hand was up.
No, he was quiet for quite some
No, it
seconds
was
and
not.
there was no hand.
It's not.
No, there's no
We have
debate.
fixed a resolution in this house.
Honorable Dlangwini, this is not a debate.
It's
It
just
is not a point of
that
order.
AFP is supporting
It is
Israel.
not a point of order what you are saying. Please, I have ruled on it and it stands. Action essay.
Thank you very much, House Chair. House Chair, we must be frank about the report that it is secondary confirmation that this department consumes billions while delivering little measurable benefit. DIRCO's bloated network of 115 foreign missions across 102 countries may look impressive on paper, but in reality, it is an overstretched, poorly managed bureaucracy that fails to translate diplomacy into development. Despite spending over 7 billion in the last financial year, the department has regressed to a qualified audit opinion, with a shocking 2.2 billion in irregular expenditure and an incomplete asset register that cannot even account for the hundreds of millions in state properties abroad. This is not a reflection of effective governance, but it is the cost of complacency and a culture without consequence. Honorable House Chair, from day one, Action SA has argued that South Africa's foreign policy must deliver tangible returns to our people. Surely, our foreign missions must be geared to promoting trade, attracting investment, and strengthening partnerships, not chanceries and residents that decay while taxpayers foot the bill. The department's 24% vacancy rate, its failure to modernize ICT systems with over R1 billion, and the poor upkeep of state-owned properties abroad all reflect an institution that is detached from its mandate. To be clear, Action SA is not calling for a retreat from the world, but believe that we desperately need strategic rationalization of our diplomatic footprint. Action SA believes that there is an urgent need for a comprehensive audit of our foreign missions to determine which serve genuine economic and strategic value and which ones should be consolidated or closed. Diplomacy must deliver dividends, not deficits, under this government. Thank you so much, House Chair.
Thank you, Honorable Member. ACTP.
Chairperson, South Africa's international relations budget reflects strategic ambition but lacks fiscal discipline. Parliament must demand data on measurable impact with ethical consistency and transparency in global engagements. The portfolio's BRRR on international relations and cooperation reveals persistent concerns. The department underspent its 6.5 billion rands by 1.1 billion in 2024-25, largely due to delays in infrastructure upgrades and unfulfilled diplomatic posts. Yet, this underspending coexists with irregular expenditure totaling 44.5 million as flagged by the Auditor General. The ACDP has consistently called for value-based diplomacy, budgetary accountability, and ethical consistency in foreign policy. DECO's continued support for regimes with appalling human rights records, including recent engagements with Iran and Belarus, undermines South Africa's constitutional commitment to dignity and freedom. Parliament has failed to interrogate these contradictions, despite civil society and media critique. Furthermore, the African Renaissance and International Cooperation Fund, known as ARF, remains opaque. Its disbursement lacks clear performance indicators, and Parliament has not enforced Section 5 of the ARF Act, which requires transparent reporting and measurable outcomes. Social media commentary has criticized Parliament's silence on the diplomatic property scandal in New York, where millions were spent on a derelict building. This reflects a broader failure to exercise oversight over DECO's asset management and global footprint. I thank you.
Thank you, Honorable Member. UTM.
Thank you so much, House Chair. South Africa's diplomatic missions should mirror our economic ambitions, values, and our duty to help the African continent realize its long-awaited renaissance. Yet our foreign policy vision has become uncertain, weighed down by structural failures within the Department of International Relations and Cooperation. The department's vacancy rate is an example of this, for instance. Many of our missions also operate from neglected buildings with outdated infrastructure and do not have a clear plan of action. The government's decision to close 10 diplomatic missions abroad captures the depth of this crisis. Even though cutting costs may be sensitive, but doing so without a strategy may harm our long-term interests. The closure of some of the missions in the West undermines our economic reach in the long run. Instead of closing doors, we should be refocusing the work of our missions to attract investment, promote trade, and grow tourism. To achieve this, our embassies must be led by capable, politically aware diplomats who understand South Africa's interests and can act decisively. These positions cannot be rewards for political loyalty. Each mission should have measurable targets and work closely with the Departments of Trade and Industry, Higher Education, and the Department of Finance to ensure that South Africa's economic objectives are realized. The absence of trade attaches, as revealed by the Minister Pakstawu, exposes a serious gap in our diplomatic effort, and without experts on trade and industry, we cannot expand our markets or bring investors to our shores. We must also invest in young South Africans who will serve as future diplomats. Our missions should identify opportunities. I understand the Parliament.
Thank you. Rise.
No, cancer, Chair. In the spirit of unite. In the spirit of unite.
Thank you. Bosa.
Thank you, House Chairperson. The history of our nation has been premised on the fact that our foreign policy is built on two pillars, both on human rights and trade as its objectives. History is witnessing a moment where both those things are being realigned. On the first, which is a question of human rights, I think all of us as South Africans must welcome the ceasefire in the Middle East and continue to fight the battle for the upholding of human rights all over the world. This presents to us the second, which is the opportunity as geopolitical alliances are being restored. And in this regard, I want to urge that it becomes important that South Africa lay out its economic story so that we can begin to expand our trade opportunities all over the world. And this is a massive opportunity that we can maximize during the hosting of the G20 coming up in the next while. in reading the department's own report, I think fellow South Africans, we all ought to be concerned, not celebrate the fact that we've now got over 100 missions. Diplomacy in the world is undergoing severe change, and therefore our diplomats need to be younger, they need to be better trained, but we need to also rationalize the amount of diplomatic missions we put forward, because our budget simply cannot sustain it. On the third issue, I would argue that as the president returns from ASEAN in Malaysia, that this is a powerful model for us to strengthen our South African development partnership agency, which has become stuck in administrative dilemmas.
Honorable Siabi, please mute your mic. Continue, Honorable.
The market that sits in SADC is significant, and I think we can develop something similar so that we become a better trading bloc, not only for the continent, for what we do in the world. Thirdly, I think we need to continue to fight to strengthen democracy. We cannot sit here whilst the right of Zimbabweans are being suppressed. We welcome elections in other parts and note that we've got to fight for democracy. Lastly, honorable members, it's time that we elect an ambassador to the US. We cannot delay this any further, because without an ambassador, we cannot continue trade talks. Thank you very much.
Thank you. ATM, Al-Jamaa.
Honorable House Chair, honorable members, fellows, beloved humanitarian South Africans, Al-Jamaa supports this budgetary review. We acknowledge the department's continued commitment to advancing South Africans' foreign policy objectives, promoting peace, multilateralism, and solidarity with oppressed nations. DIRCO plays a vital role in positioning South Africa as a voice of conscience on the global stage, particularly in support of the Palestinian struggle, the Sahrawi people, and all nations striving for self-determination and justice. We commend the department's work in strengthening the African agenda through active engagement in the African Union and regional bodies, as well as through economic diplomacy that fosters trade, investment, and cultural exchange. Al-Jamaa advocates for the people-to-people diplomacy, engaging South Africans abroad, youth exchanges, and partnerships that enhance our nation's global footprint. Al-Jamaa expresses appreciation to the Minister, Deputy Ministers, the Director General, and all officials of DIRCO, as well as the International Portfolio Committee of International Relations and Cooperation, whom I am thoroughly proud and grateful for, especially under the guidance of Honorable Supra, managing this portfolio very well with par excellence. I also place on record that all the government departments that I mentioned, to their true dedication under challenging global conditions, we stand firmly behind a foreign policy rooted in justice, human rights, and the advancement of global peace. I'm proud of South African stance to continue to echo our strong stance on principles of humanitarian rights. Free, free Palestine! Free, free Palestine!
Thank you, Honorable Member. MCC, PAC, UAT, Good, ANC.
Thank you. Thank you, House Chair. Honorable members, this report represents a positive step in strengthening our collective efforts to ensure that South Africa's international relations continue to serve the interests of our people and the broader African continent. It reflects a department that is increasingly aligning its work with the national priorities of growth, peace, and cooperation. We acknowledge the progress made in enhancing governance and performance management within the department. The efforts to strengthen systems, improve coordination between missions abroad and headquarters, and build institutional capacity are commendable. These are the building blocks of a capable and developmental state, one that conducts its international work with integrity, discipline, and a sense of national pride. While there remain areas that require continued attention, the overall trajectory is encouraging. The department has demonstrated a willingness.
Honorable members, sorry, Honorable Kumbaka, can you please keep it down? We can't hear the member at the podium. I didn't say who and who, I said, can you please keep it down? Continue, Honorable Member.
The department has demonstrated a willingness to learn from past challenges and to apply corrective measures that will improve service delivery and strengthen accountability. The spirit of renewal and improvement is welcomed. Honorable members, our foreign policy is an extension of who we are as a nation. Our foreign policy is guided by values of peace, solidarity, and mutual respect. Oversight in this area must therefore extend beyond our borders to where our missions operate, where our partnerships are built, and where our country contributes to a better Africa and a better world. This report, therefore, is not only about performance, it is about purpose. It is about ensuring that our diplomacy remains people-centered, that our engagements advance development and justice, and that the department continues to fly our flag with dignity and responsibility. South Africa's position on the question of Palestine remains firm and consistent, and we support the right of the Palestinian people to self-determination. With these words, as the African National Congress, we express our support for the adoption of this report. I thank you.
Thank you very much, Honorable Member. I put the motion again. Are there any objections? The Chief Whip of the MK.
Object. Thank you, House Chair. We object to the report. Thank you.
Thank you.
House Chair, can you please note the objection of the EFF?
With those objections, the report is agreed to. Honorable members, we have come to the end of our program. I request members to stand and wait for the presiding officer and the maids to leave the chamber. That concludes the business of the day, and the House is adjourned.